our Senate President, Senator Tito Soto, na mabilis na nag-abiso at tumawag ng meeting para siguruhin na ang mga pumapasok din po dito sa Senado ay ligtas at maalagaan ang bawat isa. Mr. Chairman, we wanted to ask a lot of questions and raise a lot of issues. Specifically, for example, sa DOH. Ano nga po ba ang capacity of our 70 DOH-supported hospitals which are already somehow, and according to news, ay overcrowded na din even prior to the 2019 coronavirus outbreak. Our point is we have limited resources. Kung marami ng patients under investigation or PUIs, San Lazaro for example, hindi na po ba magagamit ang hospital para sa ibang sakit ng mga Pilipino? At yun nga po, magkukulang talaga ang mga personnel, resources, at facility natin. Tama naman po talaga yon na mapag-usapan at masiguro natin na may magagawa po tayo at gagawin. At habang tumataas po ang bilang ng mga PUIs, nagkakaroon din po siyempre ng banta sa kalusugan ng ating mga manggagawa sa mga frontline service at mga hospital. We also need precautionary measures at our workplaces. The good thing is that we already passed into law the Occupational Safety and Health Standards, or OSH law, thanks to our colleagues present here today. Because under this law, all employers are required to keep their workplaces safe and healthy, not only for our workers, but also for the general public. Let me reiterate that non-compliance with occupational safety and health standards is a crime. Buhay at kalusugan po ng ating mga manggagawa ang nakataya sa pagpapabaya ng mga employers. I'm glad that the Dole family is also here because we want to know from them the extent to which our employers provide information about nCoV, monitor the health of their workers, and provide personal protective equipment or PPE, most especially to our healthcare workers. Other than OSH, we also expect our friends from Dole to urge the private sector to adopt telecommuting for workers whose tasks can be done remotely to minimize possible spread of the disease. Ito po ay ilan lamang sa mga pwede nating magamit para makatulong sa DOH na mapigilan ang pagkalat ng nCoV. Now, as regards to the travel ban, there are some specific issues we would like to raise. For example, since transmission from asymptomatic persons is a reasonable possibility, should the response of the Philippine government be reassessed or be recalibrated, especially since border checkpoints may be rendered useless if the infected persons are asymptomatic. Ito po yung mga nagbabother na katanungan sa amin at kanina nga po pinag-uusapan ng mga senador dito, paano nga ba makakatulong iyon kung asymptomatic nga? Kung pumasok, hindi naman po sila madedetect. Questions like, are we ready? Binanggit kanina ng Senator Nancy. Kung sakaling mag-repatriate na po tayo ng mga OFWs, how are we preparing for that? Kung meron na po, at dasal natin, wag naman sana. If it happens na may Pilipino na po na magkaroon nitong nCoV, what can we do? Ano ho ba ang economic impact nitong mga nangyayari na ito? Maaaring apektado ang turismo, although we feel na yung domestic tourism ay buhay na buhay pa naman po. Pero alam natin lahat na di hamak na malaki ang nawawala sa atin kung tayo pa ang mamumroblema sa mga dayuhang PUIs. Lalo na kung mahahawa po ang mga manggagawa natin sa mga hotels, restaurants, resorts, airline at airports, transportation at ang general public. Ito pong mga ito ang ating nais pag-usapan at muli, tayo pong lahat ay naririto para makinig, para makiisa at makatulong. Sa bawat isa po na naririto, lalo na sa mga executives na naririto, maraming salamat po sa inyong presensya. Maraming salamat, Mr. Chairman. God bless us all.
Salamat, Senator Villanueva. Next is Senator Riza Antiveros.
Salamat, Mr. Chair, at salamat, Sen. Joel. Mr. Chair, I'm in this hearing today not only as a legislator, but as a concerned mother and as a concerned citizen. Bihira lang po ito mangyari, but I do genuinely welcome the President heeding the call to impose a China-wide temporary travel ban. I was one of the first to recommend it. Siguro sa usapin ng public health emergency and preparedness, we should all be on the same side. Ang pangunahing dahilan kung bakit ako nanawagan ng temporary China-wide travel ban, Mr. Chair, is to give time to our local health authorities to properly set up safeguards in our health systems to effectively respond to the 2019 nCoV. Ngayon, nakakalungkot at nakakabahala at the same time na ang pinakaunang namatay sa nCoV sa labas ng China ay nasa Pilipinas. I think this hearing should boil down to one thing. Handa na ba tayo? We don't want our countrymen and women to panic. That's why we have to assure them and answer the most fundamental question. Are we prepared for the worst? At kapag ka, Mr. Chair, kinilala nyo na po ako para makapagtanong, yan po yung patutunguhan ng aking mga tanong. Sa ilalim din ng RA 11332 o yung Mandatory Reporting of Notifiable Disease, na isa po akong co-author, na may kinalaman lalong-lalo na sa pagtatalaga ng mga Epidemiology and Surveillance Units o ESUs sa buong bansa natin. Nang sa gayon, kung sakali mang maging malubha pa ang sitwasyon natin dito sa Pilipinas tungkol sa 2019 nCoV, ay tayo nga ay mas tiyak na maging handa, makapagresponde at magawang ligtas at malusog yung ating mga kababayan. Salamat kaayo, Mr. Chair.
Thank you, Senator Riza. All right, at this point, let me lay down our ground rules for this hearing. To have an orderly discussion, we will allow questions. Soto as courtesy to our Senate President, to be followed by Senator Binay, Senator Hontiveros, Senator Tolentino, Senator Lacson, Senator De La Rosa, Senator Villanueva, Senator Pangilinan, Senator Drilon. Due to our limited time and to give all senators here a chance to ask, we will only allow 5 minutes per senator to propound questions. Answer of resource persons will not be counted. While we welcome manifestations, recommendations, and criticisms in this hearing, we wish to humbly request that we stick to the most crucial topics that this committee needs to address, namely, number 1, the nCoV acute respiratory disease, number 2, precautionary measures the government is taking, number 3, implementation of the travel ban, number 4, repatriation plan, and number 5, the tourism and economic impact. The chairman reserves the right to interject questions. With the indulgence of my fellow senators, before our questioning and statements, we shall first hear the presentation of the World Health Organization, followed by the presentation of the Department of Health. Go ahead, Dr. Rabi. You may start your presentation. We'd like to recognize our Senate Majority Leader, Senator Migs Subiri. Go ahead, Dr. Ravi.
Good morning, Chairman Senator Bongo. Thank you for this opportunity. Senate President Vincent Soto, Honorable Senators, Representatives, fellow colleagues from the Filipino government, thank you for this opportunity. While the President, thank you. I will present to you the sequence of how events evolved and the timelines. It's important to understand this, and I will also talk a few things about what we know about this disease. This is a new disease. Many questions are not clear at this point of time. We are working very closely both within the WHO and with international partners to understand this disease better, and we acknowledge the good support we have received from the government of China and its institutions in these efforts. So let me start, and as I go along, I will explain how things evolve. Next slide, please. A very brief update on the number of cases. These were the numbers that were reported to us at WHO yesterday evening. That shows 17,391 cases reported. I like to inform you that the numbers this morning have now risen to 20,438. The vast majority of these cases, in fact 99% of the cases, are within the People's Republic of China and its special administrative regions. Of the 20,000 cases, approximately 2,788 cases are classified as severe disease. The 2019 nCoV acute respiratory disease causes severe disease and can result in death following respiratory and renal failure. However, the number of patients developing severe disease, as you can see, is less than 20% of all confirmed cases. To date, my slide shows 361 deaths reported. To date, we have 427 deaths reported. All of them have been within the People's Republic of China and one death that was reported here from the Philippines. As of today, there are 23 countries that have reported confirmed cases across the world. Based on this information, the WHO has classified the risk within China as high and regionally and globally as high. Next slide, please. This shows the timelines of how this situation has evolved. Next slide. On the 30th of December, a cluster of cases of pneumonia of unknown origin was reported in the city of Wuhan in Hubei province, China, to the China National Health Commission. Next slide. This information was conveyed to WHO on the 31st of December, and on the 1st of January 2020, since the cases were concentrated around the Hunan seafood market in Wuhan city, the market was shut down. I want to clarify here that although this is called a seafood wholesale market, what was for sale was not only seafood. There were many exotic meats, among other things, for sale at this market. This is important to understand the following events. Next slide. On the 7th of January, the China National Health Commission informed us that they had isolated a novel coronavirus as the cause of this pneumonia outbreak. I want you to focus on the timelines. This is since the 30th of December to the 7th of January. It's important to realize that within 7 days, the Chinese authorities identified the cause of this outbreak as a coronavirus. This is important because in comparison to the 2003 SARS outbreak, for 1 month, we couldn't isolate the pathogen, right? So this is tremendous progress in regional and global preparedness to deal with an unknown emerging disease. Next slide. On the 11th of January, the first death was reported in Wuhan city. Again, I draw your attention to the fact that till the 11th of January, nobody suspected that this outbreak of pneumonia could cause deaths. This date is important because by the 31st of January, WHO declared this event a public health emergency of international concern within 20 days. Next slide. By the 12th of January, China shared with WHO and globally the whole genome sequence of this new coronavirus. And the virus was formally designated as the 2019 novel coronavirus. Explaining in layman's terms, the whole genome sequence means the molecular structure of this coronavirus. It's important to understand that because this structure helps to develop tests for identifying whether somebody is infected by this virus. Again, I'm stressing the dates. It's only on the 12th that we had with us the whole genome sequence, and based on that, the ability to test for the presence of the virus. Next slide. On the 13th of January already, using that data that China shared, Thailand confirmed the first case of this virus outside of China, but in a traveler coming from Wuhan. Next slide. On the 16th of January, Japan confirmed its first case. Next slide. By the 19th of January, the Republic of Korea reported one case, and for the first time, there was confirmation of cases outside of Wuhan and Hubei province, in Beijing and Guangdong. Next slide. On the 20th of January, there was the first reports of infection in healthcare workers in Wuhan city, China. Again, I draw your attention to the timeline, 20th of January. Until then, the perception was that this disease is caused from a food source, because coronaviruses are normally associated with meat, and the assumption was, because it was concentrated around Wuhan, that people had eaten some meat there. It was only on the 20th of January when health workers at the Wuhan hospital were infected, and this was confirmed, that the first evidence that this could possibly be transmitted from a patient to another person emerged. Important timeline again. This is so much that we didn't know about this disease that is now coming to light. Next slide. On the 24th of January, there were 835 cases reported. The vast majority were within Hubei province. And at this stage, there were isolated cases being confirmed from all of the provinces of China except Tibet. China has 23 provinces. Next slide. On the 30th of January, the WHO Emergency Committee for International Health Regulations, convened by the Director General, declared this a public health emergency of international concern. Due to timeline differences, that happened to be 31st of January Manila time, because it happened late in the evening in Geneva. Again, it's an important timeline. I want to also explain that the DG summoned the emergency committee for the first time on the 22nd of January to review this incident. And the emergency committee is actually not WHO staff members. It's a committee of global experts that are selected based on the emerging health threat that is being reviewed. And the emergency committee necessarily includes a member from the country affected. That means an expert from China. So on the 22nd, when they met, the evidence available was inadequate for the emergency committee to make a conclusion. And they asked for further evidence, and they reconvened on the 23rd of January. However, at that time, there was no clear evidence to classify this event as a public health emergency of international concern. But recognizing the anxiety and concerns of member states, the DG requested the emergency committee to be available to be reconvened at short notice, and on the 30th of January they were reconvened, and they came to a conclusion that based on increasing numbers of cases within China, increasing numbers of deaths within China, and the presence of cases in several other countries. At that time, I believe it was 12 other countries, including, for the first time, confirmation of person-to-person transmission outside of China in 4 countries: Germany, Japan, Vietnam, and the United States. The emergency committee decided to classify this event as a public health emergency of international concern. At this time, when this was so classified, the outbreak was causing about 25% severe cases and close to 3% deaths. However, and I want again to reiterate this, because in comparison to the Middle East respiratory syndrome, which was also caused by a coronavirus, the mortality rate was not 3% as in this case, but 34%. So even though there was low mortality, recognizing the diversity in healthcare capacity across member states and their possible capacity to deal with this outbreak, and also acknowledging the very significant, possibly unprecedented measures being adopted by China to contain the spread of this disease, including a lockdown of a city of nearly 9 million people in Wuhan that has never been done in global public health, WHO decided that it is now time to classify this event as a global public health emergency. And the purpose of this was to ensure that we can contain the spread of this disease and mitigate its impact in other member states. That was the purpose. Reaching this conclusion, the emergency committee and WHO concluded that we still believe that this outbreak can be controlled like the previous 2 coronavirus outbreaks of SARS and MERS-CoV, but that we need to increase the preparedness and response capacities across all member states so that they are prepared to deal with possible importations and the possible emergence of local transmission. This has been our focus not just after the emergence of this outbreak. Since the SARS outbreak, especially in this region of the Western Pacific region where the Philippines and China are both, WHO has been working very closely with member states using the Asia-Pacific Strategy for Emerging Diseases to strengthen country capacities and readiness to deal with these situations. Next slide. Next slide, please. So, I want to summarize the impact. Who is affected? Who dies? Next slide. We look at the data. This data is about 3 days old now, but about 70% of cases are among people above 40 years of age. (64% of the cases have been males. About 40% of the cases had some underlying pre-existing medical condition. Oftentimes that was diabetes, high blood pressure, cardiovascular disease, or cancers. Next slide. The deaths. I have revised this based on current data. The death rate now is at 2%. Yeah, so the death rate is now going down because we are testing more people who are less severely affected, who have mild symptoms. And in this scenario, we are seeing that the percentage of deaths is about 2%. 88% of these are in individuals over 60 years of age, with a median age of 75 years and an age range of 48 to 89. I draw your attention to the death here in Manila. The individual was 44 years. 76% of the deaths have been among males, and 70% of them have had pre-existing medical conditions. Next slide. So, based on all of these facts and what is evolving, the risk, as I mentioned, in China has been classified as very high, regionally and globally as high. Next slide. WHO now acknowledges that there is clear evidence of human-to-human transmission. It is important for us to recognize, and I want to explain, that the vast majority of transmission to date is acknowledged to be happening from symptomatic sick people. I'm clarifying this because there are lots of reports, and I heard it from Senator Villeneuve also, about the concern of asymptomatic transmission. We do have reports from China that the disease could be transmitted from asymptomatic people. But, and this is not surprising for a coronavirus infection. This was also there during the nCoV outbreak. But we like to clarify that the evidence to date is that more than 90% of the transmission is actually attributed to symptomatic people, right? So that is why we are advocating that people with respiratory symptoms and signs need to be careful, need to practice cough etiquette, need to wear masks, everybody needs to wash hands frequently, because if you're coughing and your droplets contain this coronavirus, it can, the virus could be present on utensils, on home items where an infected person has coughed. Again, I want to reassure you that the evidence suggests that the virus can survive on those surfaces only for a few hours, something between 8 to 10 hours. So if you have somebody sick who is having respiratory symptoms, make sure that you make an effort to clean surfaces that are handled by those people. This is an infection prevention measure, particularly in facilities that we are managing PUIs or confirmed cases until their reports are available. But it's also good practice during flu season to do this. So again, our focus is that by frequent hand washing with soap if you haven't access to water and soap, to use an alcohol-containing sanitizer. I hear your concerns. People have bought up everything on the shelves, but that's another question. What we are advocating is, and WHO has clearly provided and shared information on the use of masks. We don't see a benefit of masks to be used by the general public. We continue to advocate that people who are having respiratory symptoms, people who are dealing with large numbers of public, who are exposed to possible risk, who are in crowded places, could be wearing those masks at that time, but it would be preferable to reserve those masks for high-risk individuals, including health workers. This is important now if we are to prevent secondary transmission, especially from PUIs and in outpatient departments of hospitals. So our message is that we need to be rational about the use of masks. Factually, it shows that non-symptomatic people using masks, it will give them a false sense of confidence and put them at more risk because they tend to wash hands less. So it's more important that they wear the mask properly if they are symptomatic and that they wash hands regularly. Just because you wear a mask, you should not neglect keeping your hands clean. Because if you touch the mask and you have droplets on the outer surface of the mask that somebody else coughed on, you could still get infected. So what is more important is actually hand hygiene, right? Next slide. So we recognize the diverse impact this problem could have on health systems and countries with different levels of socio-economic development and capacities within health systems. I reiterate again, WHO has been working with member states to improve their preparedness and response capacities. I want to mention here that Philippines is one of those countries that have been proactively over the last few years building its response capacities to face such eventualities. Next slide. So, in light of this emerging threat and the evidence that we know about this situation, WHO is continuing to work with the Department of Health and other concerned government and non-government entities in the Philippines to prepare your response capacities and your preparedness capacities, to heighten them based on what is known about this disease. Next slide. A little explanation about a public health emergency of international concern. This is not an easy decision. It has implications. And WHO recognizes that events should not be easily classified as public health emergencies of international concern. The DG explained this very clearly during his press conference and in subsequent communications from headquarters. And this is a very serious recommendation that WHO takes because it provides WHO with the capacity to implement a coordinated response to an extraordinary event that requires a cross-border response through the mobilization of additional resources both within countries and across countries through the participation of international partners and donors. Next slide. So I will summarize the recommendations from the emergency committee that pertains to countries that will help prepare and increase their preparedness. Next slide. So, the Emergency Committee and WHO recommends that countries prepare for containment through strengthening active surveillance, meaning looking for cases, early detection through strengthening laboratory capacities. We commend the Philippines that the Research Institute for Tropical Medicine already has the capacity to test for this virus. Isolation of suspected or persons under investigation and case management. Contact tracing and prevention of contacts through isolation of suspected patients and mitigation of the effects of the infection through improved case management. Next slide. The recommendation also places emphasis on reducing human infection, preventing secondary transmission, meaning if you have an infected person, you need to isolate that person so that a second person doesn't get infected, and to prevent further international spread. Next slide. Collaborate and actively participate in increasing knowledge on the virus and the disease. The disease is now classified as 2019 novel coronavirus acute respiratory disease. Next slide. We remind countries that member states are legally required to share information with WHO under the international health regulations about possible cases, confirmed cases, and deaths. This helps WHO to better understand the threat level posed by this situation to individual member states and the global community. Next slide. WHO on the 31st of January did not recommend travel or trade restrictions. However, this recommendation is not binding because countries are sovereign to make decisions based on the travel patterns with the affected country and based on its health system capacities to deal with the possible threat. Next slide. However, we encourage countries to inform WHO of any travel measures taken so that these can be shared with other member states so that they may minimize social and economic disruption. Next slide. So that's the legal basis for that measure. I believe that's all. Next slide. Thank you. So in summation, I want to commend the Department of Health for its leadership and the government of the Philippines for its proactive measures. As I mentioned, WHO announced that this was a public health emergency of international concern on the 31st of January according to Philippine time, and by the 2nd of February you had implemented a travel ban among other measures. Of course, even before this, right from the announcement of the outbreak in China, the Philippine Department of Health, supported by WHO, was strengthening its preparedness and readiness and response capacities. And we continue to work with the Department of Health and the government to prepare their response capacities. We are encouraged by what we have seen. There are still measures that the country is implementing, and WHO stands ready across its 3 levels of country, regional office and headquarters to support those efforts, and we reassure the public in the Philippines to stay calm that the measures being implemented and by the government of the Philippines and recommended by WHO are, we believe, adequate to control this outbreak. Thank you, sir.
Thank you, Dr. Rabi. Let us now hear from Department of Health. Go ahead, Secretary Duque.
Thank you very much, Mr. Chairman. In behalf of the Department of Health and the Interagency Task Force on Emerging Infectious Diseases, we greet a pleasant day to the Senate President, the Chairman on the Committee on Health and Demography, and the honorable members of the Senate. And joining me are the members of the Cabinet, led by our Executive Secretary, and all the other agencies constituting the task force on emerging infectious diseases. And my fellow public servants, isang magandang araw po sa ating lahat. Again, good morning. I'd like my presentation today will cover the following points. First, some information about what the coronaviruses are in general, and in particular the novel coronavirus, which is now briefly referred to as the 2019 nCoV. But if you are attributing the disease to it, it's the correct term is the 2019 nCoV ARD, or the acute respiratory disease. The second part of my presentation would be to highlight the local or the Philippine situation, which is embodied in the timelines of very important events that have so far transpired. And third would be contextualizing the virulence of the 2019 nCoV infection against other coronavirus infections. And it's good to reiterate, even if it's been very clear in the presentation of Dr. Labia Biasinghe, the country representative of the WHO in the Philippines. And of course, lastly, I would like to highlight the actions taken by our DOH and our advice to the public. So let me just characterize the coronaviruses first. These refer to a large family of viruses belonging to the family Coronaviridae, and these viruses cause illness ranging from the common cold, which you and I every now and then experience, and to more severe diseases like the Middle East Respiratory Syndrome, or the MERS-CoV, and the severe acute respiratory syndrome, or the SARS-CoV. The 2019 nCoV is a new strain. Coronaviruses are zoonotic, meaning they are transmitted between animals and people, and as confirmed recently, human to human as well. Patients who contract the coronavirus were shown to exhibit respiratory symptoms such as fever, cough, shortness of breath, and breathing difficulties. In more severe cases, the infection can cause pneumonia, as what has happened to the first or the second case of novel coronavirus patient who died in the Philippines. This is an imported case, and I'd like to underscore that this is an imported case. The acute respiratory syndrome and kidney failure are also complications of the extreme end. Again, because the 2019 nCoV is a new strain, there is no vaccine against it. No specific treatment yet, except supportive care. Now, as of February 3, 2020, this have been shown. We can move on. Suffice it to say that the current statistics would show that the case fatality ratio for nCoV has so far gone down from 3% to 2%. That's a good one-third reduction just over the last few weeks. And of course, several other ASEAN countries also have confirmed cases, but WHO, like China, we are considered very high risk for transmission. This in contrast with high risk only for the entire Western Pacific region and the globe. Just to put things in perspective, the case fatality rate of nCoV is much less than SARS-CoV and MERS-CoV. However, it is more easily transmissible, as you can see on the slide. This map shows the distribution of the 80 persons, or rather patients under investigations reported in the Philippines. Note that the spike in number of the persons under investigations is attributed in part to the expansion of travel history criteria in our case definition from those who have traveled to Hubei to include those who have been to China and the contact tracing activities. The number of reported cases per region are as follows: 3 cases in Ilocos, 1 case in Cagayan, 15 cases in Central Luzon, 27 in Metro Manila, 4 in Mimaropa, 8 in Western Visayas, 11 in Central Visayas, 1 in Eastern Visayas, 5 in Northern Mindanao, and 5 in Davao. Of the 80 PUIs, 67 are currently admitted and isolated, while 10 have been discharged under strict monitoring. Again, 2 mortalities were reported. 1 is a confirmed case, and the other from a patient under investigation who, however, tested negative and was immunocompromised, that gave rise to pneumonia that he eventually succumbed to and died. And the immunocompromised individual, I have to be a bit more blunt about this, 3 tests revealed an HIV/AIDS case. In the next few slides, allow me to share the key events surrounding the 2019 nCoV and the Philippines whole of government response led by the DOH and the task force. Before 2019 ended, as you can see on the screen, WHO observed a clustering of pneumonia cases in Wuhan City, China. By January 6, DOH ordered strict checks on incoming travelers. On January 7, China has identified the new type of coronavirus previously not identified in humans. On January 11, the DOH urged the public with a history of travel to China to seek immediate medical consultation. The next day, the whole genome sequence of this virus was shared by China to the WHO and the public and was designated the 2019 nCoV. On the same day, DOH investigated the report of a 5-year-old case of pneumonia in Cebu City. This is a child who came from Wuhan City together with his mom. On January 17, DOH met with partners to discuss national capacity for 2019 nCoV and reported the 2019 nCoV health events. Thereafter, DOH implemented the mandatory accomplishment. We reinstituted the health declaration cards for all port arrivals because at some points this was stopped. And on January 20, the next slide, the DOH established the 2019 nCoV task force. China reported cases of human-to-human transmission. On January 21, the DOH released health advisories and issued the interim guidelines on the preparedness and response to the CHDs. On January 22, the DOH issued the guidelines for 2019 nCoV response through a department memorandum on strengthening of hospital infection prevention and control measures to prevent the spread of 2019 nCoV. The Chinese authorities locked down the city of Wuhan on January 23. Following this, Philippine airports and seaports were placed on tight watch. The Civil Aeronautics Board indefinitely suspended all operations from Wuhan to the Philippines, while Marina advised ship owners and operators with regard to the nCoV. On January 24, we received the test results of the 5-year-old boy in Cebu and tested negative for 2019 nCoV. On January 27, your DOH coordinated with DFA and discussed foreign concerns relative to the novel coronavirus. On January 28, DOH ups communication of the novel coronavirus by launching the daily case tracker and dedicated website page, www.doh.gov.ph/2019nCoV. DOH has likewise announced regular press briefings non-stop with an average of about 30 media interviews and daily, almost daily press briefings which are held for the benefit of the public and to give them the latest updates. On the same day, the DOH convened the first interagency task force meeting on Emerging and Infectious Diseases meeting. Recommendations from the said meeting included voluntary repatriation of Filipinos and travel restrictions for individuals coming from Hubei province. Following this, the Bureau of Immigration suspended visa upon arrival for affected Chinese nationals. On January 29, DOH convened all the CHD directors for a command conference and concerned chiefs of hospitals and directed all DOH units to attend to all persons under investigation and monitoring for 2019 nCoV infection who seek consultation and treatment. On January 30, the DOH confirmed the first 2019 nCoV acute respiratory disease case in the Philippines and initiated contact tracing. LTFRB directed all drivers and conductors of public utility vehicles to wear face masks while on duty. DFA issued a public advisory calling for the voluntary repatriation of Filipinos in Hubei. On January 31st, WHO declared the 2019 nCoV as a public health emergency of international concern. On the same date, the second interagency task force meeting for the management of emerging infectious diseases was held. On a Saturday, the IATF EID operationalized the directive of the chief executive to temporarily ban foreign nationals from China and approve repatriation and quarantine plans for the DOH. On February 2, DOH confirmed the second case of the novel nCoV ARD in the Philippines and has reported the first death in the world outside of China. Again, this is an imported case of novel coronavirus that died, succumbed to pneumonia. And February 3, the President has called for an emergency meeting on the 2019 nCoV ARD, which was attended by the DOH and principal members of the IATF EID, Committee on Health, chairpersons of the Senate, Senator Bongo, and the House of Representatives, Congresswoman Tan, and other infectious disease experts, where the President's clear directives were as follows. Number one, to make sure that there will be a regular inventory of isolation rooms, not only in the public sector healthcare facilities, but equally important, the private sector isolation rooms must also be ready. Second is to ensure that there will be a dedicated transport vehicle to ferry patients from the communities, assuming that there is going to be a community spread. But knock on the wood, I hope that doesn't happen. But just the same, we have to be proactive and we have to be indeed ready for that eventuality. And so that is why the President has underscored the importance of a dedicated transport vehicle and not use the other ambulances for transport for fear of contamination. And of course, there has been also highlighting by the President of scaling up the diagnostic capacities, not only of the Research Institute of Tropical Medicine, but last night we have come to an agreement that all the laboratories of our tertiary private hospitals will very quickly be accredited based on stringent standards for the testing of the novel coronavirus. And lastly, the President has also approved in principle the budget of 2.25 billion pesos for the procurement of personnel protective equipment on the assumption that there will be 5,000 healthcare workers who will need this, and there will be 500 or 1,500 pesos. Well, I'll be lost in the computation. I can just give you the computation later. This is going to be on the assumption that this will last for 90 days or 3 months, and they're multiplied by 3 shifts because the care will have to be round the clock, cannot be just for 8 hours. And the total amount would be 2.25 billion plus, of course, 10 million pesos worth of surgical masks. And allow me to just backtrack a little with regard to the PPE. The PPEs will include the headgear, the goggles, the N95 mask, the gloves, the apron, the gowns, which is costed at about 1,500 pesos per set. On the same day, the President reassured the public with transparency that the Philippine government is capable indeed of addressing the 2019 nCoV situation. And this is not the first time, Your Honors, we have been besieged by the similar coronavirus of 2002 and 2003, and as well as the MERS-CoV in 2014 and 2015. So we've done this before, but it is very important that we should be able to heighten all the interventions needed to respond, to mount an effective response to these evolving or emerging infectious disease. And what the challenges are that are observed with this particular novel coronavirus is this particular virus can be notorious for its ability to mutate. And to what extent this virus is going to mutate, nobody knows for sure. And that is why we have to be extra careful, and we ought to be ready at all times. And finally, I'd like to just highlight the protection interventions or measures that the DOH has been doing. Even with the confirmation of the first and second cases and PHEIC declaration or global health emergency, our advice to the public remains: practice frequent hand washing, avoid unprotected contact with farm or wild animals, practice proper cough etiquette, maintain distance of no less than 1 meter, and cover coughs and sneezes with a tissue or the crook of your elbow. Avoid close contact with people showing cold or flu-like symptoms, and ensure that food is well cooked. Travelers with symptoms of respiratory illness, either during or after travel, are urged to seek medical attention immediately. All health facilities are to enhance standard infection prevention and control practices, especially in our emergency triage departments. And we must always be ready, as I have underscored. We sincerely hope that the Senate can help the DOH disseminate accurate information better and support us in our request for a supplemental budget. This is the end of my presentation, and again, pleasant day to one and all.
Thank you, Secretary Duque. Just one more presentation. I believe Secretary Dominguez has a brief presentation. Go ahead, Secretary Dominguez.
Senate President Vicente Soto, Senator Christopher Bongo, Chairman of the Senate Committee on Health and Demography, Honorable Senators Miguel Zubiri, Franklin Drilon, Coco Pimentel, Nancy Binay, Risa Ontiveros, Panfilo Domingo, Ronald De La Rosa, Joel Villanueva, Francis Pangilinan, Amy Marcos, and Francis Tolentino, Senator Ping Lacson, members of the Cabinet, fellow workers in government, good morning. Thank you for inviting me to today's hearing. This year opens with a few major challenges to our economy, and we have to take stock of their potential aggregate impact on our economic performance. These are the African swine fever, or ASF, the eruption of the Taal volcano, and the global spread of the novel coronavirus. We have been dealing with the ASF since last year. The effort to contain this epidemic is spearheaded by the Department of Agriculture. Until cases surfaced last week in Mindanao, the incidence of the disease had been mainly concentrated in Central Luzon. Containing the ASF required culling infected pigs and safely disposing of them. To date, the Department of Agriculture reported that the number of culled pigs has reached 193,350. This led to losses for swine cultivators and a decline in the value of our hog production last year by 9.5% compared to the preceding year. We continue to successfully intercept contaminated pork imported from other countries through the Bureau of Customs' intensified anti-smuggling campaign and the Bureau of Animal Industry's heightened meat inspection efforts. Last January 24, the two agencies intercepted 25 tons of meat from Guangzhou, China, which tested positive for ASF. The disposal of the contaminated meat started on January 31 and is currently ongoing at the Integrated Waste Management Facility in Cavite. Furthermore, the Bureau of Customs the Bureau of Customs has also filed cases against entities that were caught smuggling goods contaminated with the disease. The Department of Agriculture is strictly enforcing biosecurity measures and setting up more quarantine checkpoints, as well as providing more disinfection facilities to manage, contain, and control the spread of ASF. Zero interest rate loan assistance programs will also be given to affected hog raisers. We reiterate the announcement made by the DA that ASF is non-transmittable to humans and that pork is safe for consumption. Meanwhile, ongoing activity under the Taal volcano could still result in a more explosive eruption. However, unless and until this actually happens, we can only speculate on the full impact on the economy. As of January 20, estimates from the National Economic Development Authority show that the total foregone income in the economic sectors due to the eruption could reach 6.6 billion pesos, or 0.26% of the 2018 gross regional domestic product of Region 4A, or Calabarzon. The bulk of the foregone income comes from agriculture and fishery sectors, services, and industry. Short of a major eruption, the damage to our crops and the challenges of dislocated communities to which the government will continue to respond will not significantly impact our overall growth projections. We are confident that the Department of Agriculture and the concerned government units are fast-tracking the release of production support, agri-fishery aid and livelihood assistance, and cash or zero interest rate loan assistance programs to the affected farmers and fisherfolk, as well as the implementation of the recovery and rehabilitation plans of the affected areas. The 2019 novel coronavirus, on the other hand, might very well be at an early stage of its global outbreak. So far, 99% of the infections and a large majority of the casualties have been confined to Hubei province in China. The government of the People's Republic of China has mounted an unprecedented effort to contain the spread of this virus. We acknowledge the determined and comprehensive efforts of the Chinese government towards containing this virus. To date, the only death that occurred outside China has unfortunately happened here, and although it involved a traveler carrying the virus directly from Wuhan. While the World Health Organization has not recommended travel restrictions, the Philippines, along with several other countries, is enforcing a ban on travelers from China and its special administrative regions. President Duterte has also ordered the establishment of a repatriation and quarantine facility. Given that we may be in the early stages of this outbreak, it will be a challenge to estimate the cost of its potential economic costs. We are consoled by the observation that the virus has limited local transmissions outside China. As we continue to implement proactive measures to keep our people safe, the global medical research community is working on identifying a cure. A significant impact on the economy will most likely be centered on the tourism sector. The travel and tourism industry around the globe is taking a hit as a result of the various levels of travel bans imposed by national governments and of voluntary decisions of airlines to cut flights to and from China. What has transpired in the aftermath of the outbreak of the SARS H1N1 and MERS CoV may give some preview on how the current novel coronavirus outbreak will unravel. During the SARS episode, tourist arrivals to the Philippines dropped by 1.3%, from 1.93 million in 2002 to 1.9 million in 2003, according to the Philippine Statistical Yearbook. But in 2004, tourist arrivals rebounded quickly by 20.1%, totaling 2.3 million for that year. Subsequently, tourist arrivals had increased continuously until the H1N1 outbreak in 2009, which resulted in a slight decrease in arrivals. Note, however, that the world economy at that time was reeling from the effects of the global financial crisis, which is likely to have had a larger impact on tourism. The Philippine tourism also proved resilient during the outbreak of the MERS CoV. It is worth noting that even with fewer arrivals in 2003, tourism direct gross value added actually increased by 8.8% compared to the previous year due to increased average spending per tourist. In the last few years, however, our tourism direct gross value added has been rapidly rising, mainly due to a substantial increase in arrivals from China. While travel restrictions are enforced to protect the health of Filipinos, tourism's direct gross value added will likely decrease. It is still too early to ascertain the economic effects of these efforts to safeguard our people, but the Department of Tourism will provide periodic updates as the situation evolves. The DOT has committed to continue aggressively looking for opportunities in partnership with all tourism stakeholders to sustain the gains our country has made. The agency will intensify the promotion of domestic destinations for local travelers who have decided to postpone or forego international travel for the time being. Meanwhile, the lockdown imposed by the Chinese government on Wuhan, which is considered the hub of transport and industry for central China, could create some supply problems that will affect trade and industry elsewhere. Factories have temporarily ceased operations due to the lockdown. Other factories in China are likewise just restarting operations after the long Lunar Year holiday. A few have predicted economic disruption on a major scale, but at this point it is too early to estimate the full economic impact. China has been the Philippines' top trading partner. Last year, more than half of our exports to China were shipments of electronic parts. In the immediate term, the temporary closures of factories in China and possible disruption in global supply chains may cause a temporary slight decline in our exports, particularly of electronics and auto parts. Incidentally, our top imports from China, such as steel, machinery, and petroleum, are products that do not seem to carry the nCoV virus, though we will continue to take all necessary precautions. The Department of Industry and Trade has committed to work closely with affected Chinese and China-based companies who will be looking to strengthen their operations by adding a production site outside China. While these developments may dampen our growth somewhat, domestic tourism is expected to increase as more people would likely prefer to travel within our borders, thus boosting domestic consumption. With our Build, Build, Build program firing on all cylinders this year, complemented by a benign inflation rate and a stable monetary policy, we expect the economy at large to sustain its momentum. Rest assured, we are continuously monitoring these developments and will regularly update the legislature. At this moment, it is reasonable to expect that while these developments might slightly restrain our economic expansion, these threats are not enough to force a dramatic reduction in our growth estimates. We are standing by our working projection of a GDP growth rate between 6.5% and 7.5% for 2020. Thank you.
Thank you, Secretary Dominguez. Would like to acknowledge the presence of Senator Amy Marcos and Senator Coco. Ay, Senator Coco ba? Hindi kita nakilala. Senator Coco Pimentel. Anyway, may we know from the Executive Secretary what are the directives of the President to address the 2019 novel coronavirus? Go ahead, Secretary Miguel.
Mr. Chairman, before I would proceed on the directive of the President vis-a-vis the coronavirus, may I just read a note for the committee. First of all, I would like to thank the committee and its members for the opportunity to present the real situation and the government's efforts to contain the coronavirus. As you can see, all the secretaries of the concerned agencies are here not only to put to rest any worry that senators may have, but more importantly, assure the Filipino people that their government is working to contain this virus. If the honorable senators would allow, we would like to get your support in sharing to the public that they too have a responsibility in their government's efforts to prevent the spread of the virus. From the simple washing of the hands and practicing good coughing etiquette to complying to self-qualitative rule for travelers, we need the cooperation of all. Sama-sama tayong sugpuin itong virus na ito. The Filipino is stronger than any calamity or virus it may face. Thank you, Mr. Chairman. Now, may I proceed with the directives given by the President?
Go ahead, Secretary.
Immediately when the World Health Organization declared that this is an international emergency, the task force on the Interagency Task Force for Management Emerging Infectious Diseases in the Philippines met and recommended to the President, who approved the following measures. 1, a temporary ban against the entry of any person except Filipino citizens and holders of permanent resident visa issued by the Philippine government coming from Hubei province as well as other places in China where the spread of the 2019 coronavirus has been officially confirmed. Number 2, a temporary ban against the entry of any person except Filipino citizens and holders of permanent resident visa issued by the Philippine government who within 14 days immediately preceding arrival in the Philippines has been to Hubei province as well as other places in China where the spread of the 2000 coronavirus has been officially confirmed, and those traveling from China via Hong Kong. Letter C, a mandatory 14-day quarantine for Filipinos and holders of permanent resident visa coming from any place in China. Letter D, temporary ban of Filipinos from travel to Hubei province as well as other places in China where the spread of the 2000 coronavirus has been officially confirmed. And lastly, the establishment of a repatriation and quarantine facility somewhere in the north, still being studied and considered at this point. That's all, Mr. Chairman.
Thank you, Secretary Medaldea. Anyway, to Secretary Duque, it has been confirmed that the virus can be passed from human to human can the virus survive on the surface of inanimate objects such as cargo or shipment coming from affected areas? Isa po ito sa concern ngayon, aside dun sa tao, kung i-contain natin yung i-isolate natin yung tao, quarantine natin yung tao, how about the cargos? Yung tanong na yan kasi sabi nyo 8 hours yung survival period nung virus. Pero itong cargo na darating dito, paano natin sila mako-contain? Pag hinawakan ng taong possible ba na mahahawa rin po tayo? Tulad yan dito sa Senado, nag-meeting po sila kahapon, di ako naka-attend. Pinatupad muna nila yung, bawal muna yung kamayan. So, paano ngayon, SP? So, si Senator Drilon, Duterte feast po na siya ngayon. Bawal daw hindi rin, hindi yan. Feast bang? Hindi pala. Ma'am. Anyway, pakisagot lang po, Secretary Duque.
Maraming salamat po, Ginoong Chair. Yung pong cargo, yung mga container vans, pagka nabilan po ito sa araw, yung pong virus ay posibleng mamatay dahil heat labile. Pangalawa po, ang atin pong pinaka available information is that yes, the novel coronavirus can survive and stay for as long as 10 hours on inanimate objects like the surface of the table or computer keyboard, the telephones, the fomites, which would include the handkerchiefs, the beddings, pillowcases, the foam, etc. From few hours to several hours, and I think the latest information is up to 10 hours. So, yun lang po ang masasabi natin at there have also been information coming our way that the virus can be difficult to inactivate or to neutralize when the climate, when the temperature is low and when humidity is also low. So, tuyo at malamig, yan po ang medyo mas mahirap ma-neutralize yung novel coronavirus.
Ibig sabihin, anong temperature po siya kayang mapatay yung virus?
Unfortunately, Chairman, hindi po masabi yung talagang with accuracy kung ano po yung temperature. It's just generally stated in the literature, kapag malamig daw po at saka tuyo, doon medyo may kahirapan na ma-neutralize. Pero dito naman sa Pilipinas, alam po naman natin na relatively speaking, we have a much warmer climate, mas mainit po sa atin at maumido. So palagi ko ito ay makatulong.
Baka sa init ng ulo ng mga tao dito, kaya bang patayin yan? Anyway, and then another question, itong sa proper use of the face mask ngayon. How about you, Dr. Mata? Can you... Sige po, ipakita niyo po. At saka yung shortage nitong mask. Bakit iba yung itsura ng mask mo sa mask ni Senator Coco? Meron din. You may stand up. Dito, you may use the restroom.
Good afternoon, Your Honor. Let me explain the difference. Kasi po itong kay Senator Coco, yan po yung surgical mask. This one is the N95. Now, I'm just gonna discuss first this one. Itong surgical mask, ito yung parating hinahanap natin. And there's an issue of, sabi kunwari, kung may sakit ka, you use it this way. Kung wala ka daw sakit and you don't want to get the disease, you use it this way. That's a fake news po yun. Because actually 3 years ago, somebody asked me that already and I made some research on that. So, before these issues, meron na pong isyong ganon. Hindi po pwedeng baliktarin dahil ang outside area po is the water resistant, waterproof. Design po siya na kunwari may sinipon, may nagbahing, may dugo, hindi siya, it will resist. This one is the absorbent. So, i-absorb niya yung laway mo, sipon mo. In an example like diaper po. Yung diaper, water resistant ang labas, yung loob is absorbent. Hindi nyo pwedeng baliktarin yung diaper kung wala kang sakit or kung may sakit in the same way. Dahil lang nag-invento po niyan is dahil sa loob po dapat yung puti. And when you say kung wala ka namang sakit, pwede mo bang ibaliktad? Actually, hindi nyo po alam kung wala kayong sakit eh. For example, if we promote that and a person from China came in, tapos binaliktad din niya, di bahing siya ng bahing sa loob, lumalabas. Kasi hindi ina-absorb eh. And number 2 example, for example, ganito yung pagkasuot ko. So may nagbahing, pumunta yung virus dito, kumain ako. Tapos pagbalik ko, sabi pwede baliktad. So ano nangyari? Yung virus diniliver ko sa harapan ko. So hindi po pwedeng ibaliktad. And how to use it properly is don't touch the outer and inner, only the cords. Tapos fix the upper area. So kung matangos yung ilong nyo, talagang ganun. Kung hindi naman matangos, ganun nyo na. Tapos pull down nyo po yung ilalim. Now, with regards to the protective power po niya, is not really that protective because may loose areas po tayo. The main purpose po ito is to protect all of you from me. So kung ako ang may sakit, I have to wear this one.
Dr.
Kasi
Mata,
absorbent po.
question lang po. Sa katanungan ng karamihan, ang may sakit lang ba ang kailangan magsuot ng mask o kahit na walang sakit? Kasi nagkakaroon tayo ng shortage sa mask ngayon kasi sabi nila nagpapanik buying. Yung iba naman po hindi raw kailangan magsuot. So ano ba ang dapat?
Okay, thank you for the question, Your Honor. Ideally po, in this time of shortage, yung may sakit lang sana. So in other words, kung yung may sakit, siya lang ang susuot, tayong lahat ay safe na. We don't need to wear. So kunwari, 5 lang sa room na ito ang may sakit, 5 lang yung gagamitin natin. Pero kung yung may sakit, ayaw niyang magsuot, then tayong 100 ang susuot nito. So it goes to the discipline as well. So kung hindi sila mapilit na magsuot, then magsuot ka na lang. So it's still on the discipline side na kung may sakit ka, please, you have to wear this one.
Ano ba kailangan suotin? Yung isa, yan mas manipis o yung N95 ang dapat?
Okay, for the question on N95, yung power po ng N95 is talagang sealed po siya. So if I'll wear this in this way, as you could see, halos hindi na ako makahinga. Nahihilo na nga ako eh. In all honesty, it decreases your oxygen by 20% because that's the purpose of it. It should be 100% kung pwede, all the air should be filtered through these areas. So kung hindi ka nahihirapang huminga, not all the air that came into you is filtered. So this is good for hospitals. If you are in front of a person who is sick, use N95. So the suggestion is all hospitals should provide N95 for the employees. Nahirapan nga ako.
Yun ang nasa hospital.
Pang-hospital po.
N95. Kasi mas maraming stock yata yung ordinary na mask.
Yes, cheaper ang surgical mask. Much expensive ang N95.
To Secretary Lopez, ina-address niyo na ba yung shortage at saka yung setting the standard retail price nito at wala pong hoarding? Hinuhuli niyo ba yung mga nag-hoarding nito?
Yes, Mr. Chairman. Nung umpisa pa ho, about 2 weeks ago, we started to monitor first the prices and then the supply of surgical masks. So at that point, ang ating SRP, also as prescribed by the DOH, nandun tayo sa 1 peso to 8 pesos per mask. And we were able to catch about 18 violators, and inisyohan po yun ang notice of violation, and all those notice of violation after 48 hours will be converted into the filing of charges against them. So they are now being heard at the Fair Trade Enforcement Bureau, can be subjected up to about 300,000 penalty per store per violation. The current problem is less on the price but on the supply. Marami po talaga nag-out of stock simply because of the sudden the surge in the demand. Marami talaga nag-demand, some can be considered panic buying. And the normal inventory ng ating mga drugstores are not that high. But once na out of stock, these drugstores would normally, of course, reorder to refill their inventories. Now, the recent feedback that we're getting from the drugstore, even their usual suppliers, nahirapan na rin silang kumuha because abroad, even in other countries, kailangan din nila yung supply. So not all are able to supply them with the desired quantity. So the government had an initiative proactively search for its own suppliers or sources. And the main source that we were able to talk to over the weekend was the lone producer manufacturer of the mask, itong surgical mask, based in Bataan. Isa po siya exporter talaga. But they've been in the country for the past 41 years, and they really have been supporting the country. In fact, during the Taal eruption, nagpa-donate din sila 500,000 masks at that time. And then for this, because of this problem, the government's discussion with them, they committed to supply first 100,000 immediate supply, actually to be delivered today, which we would prioritize to give to the DOH. Dahil ang initial requirements talaga priority yung mga nasa frontline po natin, mga health workers, as requested by Secretary Duque. And then that supplier also committed, at least they have the capacity to supply and commit to the Philippines 400,000 pieces per week. And so that is what we intend to add on to the local supply. Initiate lang po yung government kasi nakita namin na pati yung private sector, they're having a hard time sourcing the supply. Importante, we have stocks or supply here in the Philippines. So once they bring the stocks to us, we will make it available first to the DOH and then one half to the DOH and one half to the public through the drugstores para ma-distribute natin. So in a month, we can commit about 1 million pieces for the public and 1 million pieces for the DOH requirement. And that can go on as long as we need the stocks. Thank you, Mr. Chair.
Thank you, Secretary Lopez. Can our health and medical experts we invited here confirm if they concur with the statements of Dr. Mata about the proper use of the mask? May we call Philippine Society for Microbiology and Infectious Diseases, Dr. Marisa Alejandria, and is she here? Annalisa Ong Lim, also medical expert, and Dr. Edsel Salvana from the National Institutes of Health of UP.
Good afternoon, Your Honor, Senator Bongo, Senate President Tito Soto, Honorable Senators. Yes, I concur with the wearing of public masks, but with additional information. I'd just like to emphasize again that those who are healthy, immunocompetent, meaning wala hong ibang sakit, hindi buntis, hindi nagkikimotherapy, hindi po kailangan mag-mask. Kung ngayon, sa sitwasyon na may nCoV tayo, kung hindi naman din kayo galing sa China o sa mga bansa na merong confirmed cases, hindi kailangan mag-mask kung walang simptomas. Ang advisory sa mga travelers na galing China ay mag-quarantine ng 14 days. So that's mandatory para ma-contain po natin ang virus, para hindi siya mag-spread sa community. Going back to how to wear the mask, okay, importante din po na naghuhugas pa rin ng kamay. Pagkasuot ng mask, yung tamang pagtanggal, huwag niyong hahawakan yung harap. Ang pagtanggal, yung nasa tenga, yun ang hahawakan pag tinanggal. And then, wash your hands. Pag madumi na din, palitan na siya. No? Hindi siya pwedeng for the whole 24 hours, suot-suot yung mask. So, kailangan tatanggalin. Papalitan na pag madumi or 6 hours. At tama po na ang magmamask ay yung pasyente, yung may ubo, sipon. So, that's our public health responsibility. If we have cough, colds, kahit na hindi coronavirus, dapat magkonsulta or magmask. Kasi hindi lang naman coronavirus ang matatransmit natin kung tayo ay inuubo or sinisipon. May iba pang mga infection na pwede tayong makuha. Okay. So, yun po yung sa mask. Tapos yung N95 naman, sa ospital po, hindi naman lahat ng nasa ospital, yung mga employee ay kailangan naka N95. Yun lang pong healthcare worker directly involved in managing or treating patients, or especially the suspected cases of nCoV. Tsaka may mga iba rin po tayong sakit na ang healthcare worker ay nag-N95. Kami po, pinoprotektahan din namin ang sarili namin. So may mga guidelines kami dyan kung kailan kailangan naka-N95. And then, I'd like just to say also that it's very, very important yung quarantine kasi nga wala pang local transmission. So, dalawang cases natin imported. So, we really have to exert all efforts to contain the virus so that it does not spread in the community. So, how are we doing that? So, yun nga yung, so we welcome very much the travel ban kasi because of the volume of travel, lalo na marami tayong Chinese tourists. So, there's a lot of risk there, no, of getting the infection. So, yung mga travelers from China, important po yung 14-day quarantine. And pag sinabing quarantine, nasa loob ng bahay. Yung mga asymptomatic, walang symptoms, dapat sa loob na, hindi sila lalabas ng bahay for 2 weeks. Yun yung kailangan sundin as a public health responsibility so as not to spread the infection. Tapos yun namang may symptoms ng travelers within the 14 days, dapat magkonsulta at sila yung magmamask. So yun po yung kailangan natin i-implement, no, sa atin, mga kababayan.
Thank you. For a while, Senator Riza Ontiveros. And I would like to acknowledge Governor Daquila Carlo Cua, National President of the Union of Local Authorities of the Philippines. And I believe the Executive Secretary wishes to be excused because he has another engagement. Thank you, Secretary Medjaldea, for attending this hearing. Now, I have one last question, very important one, to Secretary Anyo. I know your time is also very precious. Have you already issued directives and guidelines for local government units to prevent the spreading of this virus, the possible spreading of this virus?
Yes, Mr. Chairman. In fact, even before the declaration of the WHO on the public health emergency of international concern, we already issued advisory to the local government units and formalized a memo circular dated January 31 for our local government officials, particularly the governors, the mayors,
and the barangay captains to spearhead the information dissemination, to act as the crisis manager, and to be in charge in preventing the spread of the coronavirus, particularly at the level of the barangay. The mayors organized the barangay health emergency response teams led by the barangay captains, and these barangay health emergency response team shall be in charge of imposing the mandatory quarantine, 14 days, for all citizens arriving from China and its special administrative regions. And for those who manifest symptoms, immediately they will be transferred in coordination with the interagency task force to DOH designated novel coronavirus referral centers. And likewise, in coordination with the DOH, the use of an ambulance that is solely dedicated for people manifesting the coronavirus symptoms. This is actually in line with the interagency task force and with the declaration of the President. So we deal only with citizens who came from these areas, China and its special administrative regions. But for those manifesting symptoms, they should be immediately transferred to these designated coronavirus referral centers, Mr. Chairman.
Thank you, Secretary Anyo. I will just ask my other questions later. SP President Senator Soto.
Thank you,
You have the
Mr.
floor.
Chairman. Thank you. Mr. Chairman, I will not ask any questions. Instead, I'd like to focus on the concern of my concern and some other members of the Senate and, of course, our people of the unknown origin as quoted by the WHO. So, meron tayong kasabihan you want to defeat an enemy, know the enemy. So, ano ba itong virus na ito? I have received a report concerning this particular measure, this particular disease. And I'd like to show the video. Anyway, it is a little over 10 minutes. But after the video, I'd like the comment of Secretary Teodoro Locsin Jr. On the video itself. So please pay close attention to the video. I think it's somehow very interesting, if not revealing. May we have it, please? Must be audio.
Mystery surrounding the coronavirus becomes denser and denser by the day. As doubts arise about its origin and everything seemingly points to biowarfare being waged against China. According to the medical journal The Lancet, the first case of infection dates back to December 1, 2019, and the person infected had not been to the Wuhan fish market. Further critical points have also been raised by some independent journalists. Now we know that in the Wuhan biolab, the Chinese were experimenting with a modified SARS virus for military purposes. At least 3 other countries have been doing the same for years: the United States, Russia, and China. We found 3 news in this regard. The first news dates back to 2014, and it announces the construction by China and France of a biolaboratory for the research on infectious viruses in China. And guess in which city it was built? None other than Wuhan. The second news, which is connected to the first, is of 2015, in which the Pirbright Institute, a British government-funded pharmaceutical company, asks and obtains a patent for the coronavirus that can also serve, according to the patent, as a vaccine to prevent respiratory lungs disease such as contagious bronchitis. The third news is about the Bill Gates Foundation funding biotech companies that are trying to develop vaccines against the deadly Wuhan coronavirus. Bill and Melinda Gates Foundation and others predicted up to 65 million deaths via coronavirus in simulation ran just 3 months ago. I wouldn't be surprised if both the US military and the CIA were directly involved in the development of the deadly coronavirus strain. Bear in mind, the 2014 Ebola outbreak came as a result of another rogue U.S. military operation in Africa in which the Soros-Gates-funded Kenema bioweapons lab in Sierra Leone was involved. Surprisingly enough, this rogue U.S. military operation came shortly after Mark Lambert's appointment as the new U.S. ambassador in the United Nations as an effort to prevent and thwart China's aggressive influence over the UN Security Council's future decisions. And John Bolton. What was he doing at the Gates meeting? Welcome to the Atlantis Report. Everything apparently points to biowarfare being waged against China. The culprits are the Western powers, namely the US and Britain. The objective is to put stress on China in a combined effort to contain her growing power and influence. The tool, the coronavirus. The best bioweapons are not going to kill everyone immediately. They burn through too many hosts and die out. Best to make a virus that infects everyone and causes the infrastructure to fail with massive numbers of the sick. Kinda what is happening in China right now. Look at Ebola, it kills too fast and dies out relatively quickly. Coronavirus, officially called the novel coronavirus 2019 nCoV. Its contagion is a respiratory illness, a new type of viral pneumonia, in the same family of infections as SARS and MERS. It is highly contagious, up to 2-week incubation in patients with no symptoms. Just the perfect recipe for a global outbreak. I doubt any country is prepared for this. Wuhan, a city of 11 million, is completely shut down, is estimated to have over 25,000 confirmed cases and over 43,000 infections. Wuhan lockdown doesn't really help to stop spreading in other major cities in China. Chongqing can be the most affected, followed by Beijing, Shanghai, Guangzhou, Shenzhen. China has over 50 million people on lockdown right at this very moment, just give that a little bit of thought. Over 50 million people. And by the way, China is always lying about figures and statistics. The coronavirus is way more grave than they make it seem. Millions of Chinese are stuck in cities in complete lockdown. The first case in Germany was just reported. By now it is spreading across the States and Europe. Meanwhile, most stocks are hovering around their all-time highs. Remember that after the SARS breakout we went down to minus 40%. And SARS was nothing compared to this one. This is the moment to prevent getting a hit with your pension money. I suspect there will be follow-up releases until desired population levels are achieved. If they release this, there is nothing stopping them from releasing engineered smallpox, Marsburg, anthrax and so on. Or God knows what kind of chimeras they have created. And rising speculation it was engineered could be steered by the US as an accidental release from the level 4 facility 20 miles from the fish market. Extremely slick. Wonder if she has it figured out. Probably. It's a dead certainty Putin has. Another article by the blacklistednews.com reports under the title, "Did China Steal Coronavirus from Canada and Weaponize It?" Last year a mysterious shipment was caught smuggling coronavirus from Canada.
Well, we just received that last night. So, Mr. Chairman, there is more to it, but we can stop here and ask the Secretary of the Foreign Affairs to give his comments.
Mr. Senate President, members of the Senate, members of my fellow members in Cabinet, this is an example of the craziest video I have ever seen. It is also a validation of a joke I used to make about North Korea. North Korea kept announcing that we are the greatest power on earth because we are exploding atomic bombs inside North Korea. I said, at the rate North Korea is going, there will be nothing left of North Korea. Now, in this video, there are the suspects. China inflicting it on itself. 99% of all infections are Chinese. So why would they do that? Maybe the plan is for China to create a virus so strong, they will first test it on themselves. And when they are all dead, then they will spread it to other countries. Second, other suspect, US. The US has done this because they can send it all across the ocean into Wuhan and kill the Chinese. But then, later on, the other suspects are Canada. But at any rate, it says it will also spread to US and Europe. Again, this is a plot of the United States and the West to destroy China by first destroying itself. This is really clever. So I don't know if you can believe this, but on the other hand, let me say that there is no truth that China even withheld information about this disease. On January 7, Hong Kong consulate received the news from the Hong Kong government that on January 4, it had already released its preparedness and response plan for novel infectious disease of public significance. Before the discovery that you could isolate it, China was already spreading the news to all its administrative regions, who were then authorized to tell us that this is happening. 3 days later, they discover the isolated virus. In short, even before they were sure of it, they were already warning everyone. Second, from that point on, China was already warning us, and I assume warning all the other consulates and embassies about the progress of this disease. And it goes on day to day, all the way down to the 27th of January when, my first reaction when this came out and I was asked, what will you do about it? I said, the Department of Foreign Affairs consists of civil servants who are diplomats. We are incompetent to address a disease. Therefore, we are putting ourselves under the direction of the Department of Health, and all its orders will be followed by DFA throughout the world. We will not listen to anybody else in the government, including ourselves. So, from that point on, you had unity of command. Now, that's...
Anyway,
yeah.
It's good that you have expressed your opinion on the matter, because this is circulating, and I and many others who are here in the Senate are not ready to take in the contents, hook, line, and sinker. And it is best that we are also aware of what other people are saying concerning this coronavirus.
Yes, Mr. Senate President.
Is there anything else?
In fact, Mr. Senate President, there is no doubt that there are people abroad in the West who are perhaps happy that this is happening to China, because this may spell the end of Chinese power. Unfortunately for them, if that is true, this disease is only proving the resilience and strength of China. In 10 days, they have a massive containment facility. That only shows how strong that country is. This challenge will actually not weaken China, but will strengthen it in the eyes of the world as a power that just cannot be defeated even by nature. Thank you.
Thank you, Mr. Chairman. I have no further questions. I'll leave the questions to our colleagues on the matters.
Thank you, Secretary Locsin, SP Soto. Next is Senator Nancy Binay, Vice Chairperson of Committee on Health.
Thank you, Mr. Chair. Secretary Duque, tama po ba na napakahalaga doon sa containment itong contact tracing?
Kasama po yan sa protocol natin. Talaga pong mahalaga ang contact tracing, lalo na doon sa mga nagkaroon ng mga sintomas, katulad po ng dalawang Chinese nationals. Ito po ay ginagawa ng ating Epidemiology Bureau Surveillance Officers, at meron po kaming report na ibabahagi sa inyo kung ilan na po ang kanilang naabot na mga pasahero o mga mamamayan sa mga iba't ibang lugar kung saan nakasalamuha o nakihalubili ang ating pong dalawang mga Chinese patients. Yung isa nga po pumanaw, pero ganun pa man ay sa ngayon ang mga contact tracing na ginawa ay sa eroplano, sa hotels and resorts, hospitals.
Secretary Duque,
Yes.
doon sa aeroplano, 100% na huban na natawagan yung mga nakasabay nila sa aeroplano?
Hindi pa po, kasi ongoing pa rin yung ating contact tracing. Out of 331, meron na po tayong na-assess na 58, and yung pong number of contacts on currently home quarantine, 53. At number of symptomatic contacts, 5. So, we're currently admitted for isolation. 4 are admitted, but 1 unfortunately refused admission. So this is something that we might want to look into the quarantine laws of the Philippines and see how we can further strengthen. There can be hopefully a legislative space to look into how we can strengthen the penal provisions of the quarantine law and ensure that those who refuse, they will be, I don't know what the term is, forcibly made to subject themselves to quarantine measures.
Secretary Duque, Filipino ho itong ayaw magpa-quarantine?
Hindi, I will have to look into that, Your Honor. I'm sure the EB, Epidemiology Bureau, has the more granular report on this. So yung iba naman hotel resorts, hospital, andito naman, pati public vehicle, other venues, 5, hotel resorts, 41, etc. So we can give you the report now.
Sige po. And then, nabanggit nyo ho kanina, di ba may namatay ho na isa?
Yeah.
Ano na ho yung status ng body nitong
The 38-year-old female Chinese...
the 44-year-old male who passed away. Ano bang protocol natin pag namatay at may coronavirus? Ito ho ba i-cremate or do we send the body back na buo? Paano ho ba yung protocol?
We are in coordination, or we have been in coordination with the Chinese embassy. And the guidance is for the body to be cremated. Unfortunately, the first groups that we were able to contact initially agreed, and this is within the community of the Chinese Chamber of Commerce, who initially said they would cremate and put the ash rather in the ash in the whatever crematory that they have, no? But unfortunately, they backed out. So now we're talking with a funeral parlor that has agreed to do that today. So I just have to get the latest the update on this, whether in fact this the body of this Chinese national has been cremated. So we'll give you the updates as well.
Wala ho din batas that can compel DOH na yung mga crematoriums kailangan i-cremate nila kasi ilang araw na din ho ito at hanggang ngayon hindi pa rin ho siya naka-cremate.
The experts behind me are one in saying that he no longer will be infectious once dead. So
pag namatay ho, hindi na ho nagiging carrier?
Wala na ho. Hindi na ho magiging carrier. Pero naka-sealed kasi ito, naka-sealed body bag ito. So talagang kahit na may agam-agam, yung pong measures ensure that this is sealed. And therefore, the coronavirus will not be able to get out.
Pero kung ganun nga ang Secretary Duque, bakit ayaw nila i-cremate if it's no longer contagious?
Well, they have their own mindset. That's the problem with them. Sabi ko nga, pambira naman, you're fellow Chinese, no? Dapat pakita ninyo na susuportahan ninyo. But I don't know, I need to get the full story behind. But it's very unfortunate to hear stories like this, because it is at this time when they should, in fact, express more sense of, patriotism for their fellow Chinese national. So I don't know. It could difficult to understand.
Sige, Secretary Duque. And then, ilan ho yung staff na dedicated for contact tracing? Ilang staff po yung dedicated for contact tracing?
Can I just ask my EB director? Ang contact tracing po natin we have for the flights in Metro Manila, yung Cebu PAC and the PAL, dito po the whole of NCR Epidemiology Bureau, surveillance officers. Ngayon sa region naman, doon po sa mga pumunta sa mga hotels, pumunta sa mga tindahan, ay yung ating pong Region 7 Epidemiology Bureau surveillance officers.
Ilan ho?
Inaantay ko lang po. Para
Kasi, Secretary, remember, this is just one case.
Yes.
I guess, pag nagkaroon pa ng, well, hopefully, wala sanang, hindi na madagdagan yung bilang, pero kung madadagdagan, kailangan malaman natin kung if there's a need to augment yung staff, lalong-lalo na pagdating dito sa contact tracing.
But meron nung mga hakbang na isinasagawa nakikipag-ugnayan sa DILG. Kasi po kanina na-report na meron pong mga binubuong mga task force ang DILG para matukoy ng mga barangay captains, kung sino-sino sa kanilang mga mamamayan ang dapat quarantine. But of course, we need to level up their competence in being able to identify. So, yung pong technical support niya manggagaling po sa atin NCR as well as in the concerned region. But the number, I'll get back to you, ma'am.
Kasi katulad nitong dalawang pasyente na to, it's been how many days already at hindi nyo pa nakokontak 100% yung nakasalumuha nitong dalawang pasyente na to. I mean, yung hotels and restaurants, understandable, mahirap yan. But yung eroplano, una-una, may ano yan, di ba? Meron namang listahan ng SEDPAC, tsaka may flight manifest. Di ba dapat ngayon pa lang, for me, dapat, Secretary, 100% na alam na ng mga pasahero na yon na they've been exposed to the virus.
We have, as of now, 17 surveillance officers plus 50.
And this is 17 epidemiologists and about 40 disease surveillance officers.
Okay, so the information is that we have 17 epidemiologists constituting a team with 40 surveillance officers. So ito po ang ginagawa, nakikipag-ugnayan din sa kanilang counterparts sa mga pamahalaan lokal.
So siguro, Secretary, ano yung naging difficulties nyo in getting in touch? Siguro lalong-lalo na dito sa kasama nila sa aeroplano.
I am told that efforts are being made to increase the number of surveillance officers.
Secretary, siguro ito lang sa plane lang. Let's concentrate dito sa aeroplano. For example, yung flight nila from Hong Kong to Manila, I think SEDPAC yun, di ba? 100% na hubang na-contact itong mga kasama nila sa flight na yon.
I am told that the Cebu PAC and PAL have a system in place to get in touch.
Secretary, I'm asking, simple question lang. I just want to know kung na-contact nyo na ba lahat ng pasahero from Hong Kong to Manila na sumakay sa SEDPAC?
With the flight manifesto,
We have the flight.
So how many percent?
I guess, Secretary, mukhang hindi pa. Kasi...
It looks like, yes ma'am, I'll be the first one to admit it's not easy to do this. In fact,
Secretary, kasi, we are all here looking for a solution. Kaya I'm asking you, ano ho yung nagiging constraints kung bakit hindi nyo makontak itong mga nakasabay nila sa aeroplano? Baka hindi yun na nga hanggang ngayon, hindi pa rin alam ng mga nakasakay doon sa aeroplano, nakasama pala din.
Meron silang mga announcement na ginawa na, the flight number and the two airlines have already continuously shared this information so that those who actually were inside the planes would know that they have to follow the following
But
steps.
apparently nga, Secretary, hindi nyo pa naaabot lahat
Hindi
eh.
pa nga ho.
So ano yung nagiging problema? Is it kulang ba tayo sa manpower?
That's one
Or
of them.
hindi niya talaga alam kung saan sila pupuntahan kasi yung contact information sheet kulang. So, kasi may katulad nga ho, ng sinasabi, may passenger manifest ho tayo. In fact, pag foreigner kayo, meron pa tayong finifill up na form na ito yung address mo in the Philippines. Kung foreigner ka, pag local ka naman, more or less, I'm sure may database naman ng BI kung saan nakatira itong mga pasahero na ito. Secretary, ilang araw na ho eh.
Yes, ma'am. Ang contacted 17% of a total of 331.
17%?
Yes. Airlines are not sharing. Ito, baka pwede natin hong pagkaisahan ito. The airlines are not sharing contact details of the passengers. Okay? So, they're invoking confidentiality. So, ito po ang kailangan natin harapin.
Can he get the, from CAD or CAAP?
Yes, ma'am.
So, ibig sabihin, Secretary, hanggang ngayon wala pang may kopya ng flight manifest?
Meron.
Kasi ayaw ibigay ng airline?
Yeah, meron but no contact details. Redacted.
Sige po, GF.
No, that's why we can discuss it here.
Thank you, Mr. Chairman, Your Honors. In my experience, the airlines would readily give this kind of information, especially under special circumstances like we have today. So in my experience, the experience of our office, they would be willing to share it, especially during an event like this.
I guess, let's go back to the basic. Ano ho ba naging protocol natin? Who asked the airlines to provide them the manifest with contact details?
We do. The Epidemiology Bureau of the DOH was instructed very clearly to get the flight manifesto. And from then on, I thought that things would be as usual, that there shouldn't be any problems. But now, I'm being very strange. They're saying that the airlines are the ones contacting the passengers and informing them. And that we're not given the number. But all of these will be subject to validation, Your Honor, so that we will know exactly how to address this issue. It is a very serious issue.
Yes, Secretary. At, you know, ang mas nakakalungkot, parang hindi kayo nag-uusap. Diba? I mean, di sana, Secretary, kayo could have coordinated CAAP or CAP na may ganito kayong difficulties na hinaharap ngayon. Because, di ba, katulad doon na sinabi nyo, napakahalaga netong contact tracing. But apparently, kulang na kulang tayo with the permission of...
With the permission, Mr. Chairman, with the permission of
go ahead,
our other colleagues.
Senator
Simple lang po, wag na po yung airline, DOH to airline, wag na po yun, sabi nyo, hindi nag-cooperate. DOH to DOTR or directly to CAB. Hindi po pwedeng mag-usap and then they can order the airline to produce the manifest. Yun lang po.
Go ahead, Senator De La Rosa. You may interject.
Yes, with the permission of Senator Binay. Sir, Secretary Duque, once you have the manifest already, bigay nyo sa PNP. 3 days lang yan, maximum 2 days. Accounted lahat yung tao na yan. How did you suluhin ang problema? Hindi ninyo sinishare sa ibang ahensya eh. Sabi nyo, competency. Turuan yung police anong gawin para hindi mag-spread yung virus. Di ba? 2 days lang yan. Accounted lahat ng tao na yan. Pag bigyan yung listahan sa police.
Your Honor, Mr. Chairman, I'm told that these airlines are invoking the Data Privacy Act. I don't know how. This is rather strange. In a time of urgent, situation, I do not understand why this is the case, but I think that has to be investigated, and we will look into it, Mr. Chairman. Why this invocation, which I find very inappropriate, to say the least.
Okay, go ahead,
Sir?
GM Monreal.
Sir, with the permission of the chair and the rest of the members, allow me to outline, as a former airline employee, again, for 30 plus years, there are protocols. First of all, when a passenger makes a booking, the airline, before closing the reservation, they give the details. Even to the US, the addresses of the passengers are being taken down. Okay. Now we're talking about this situation. Right now, the situation is in contact tracing. As soon as the name of the passenger is related to the airline, I can attest to you that they will not withhold the name. Based on the protocols, the revised protocols now, with a person involved, if I say that that's a suspected person, based on ICAO standards, the 4 rows in front, 4 rows on the right, 4 rows on the left, and 4 rows at the back. 4 seats, seats are rows to make it more. Then those are the primary suspect or to be contacted. You don't have to call all the passengers because as a commercial carrier, they are equipped with HEPA filters. HEPA filters normally, clean the air inside the aircraft. But however, that being said, we have already been in the news that there's a contact tracing. People, as long as you tell them the flight number, the exact flight number, I'm sure if you were that on board, you will initially also volunteer yourself. So basically, I don't see any reason why airlines are going to withhold the name of the passenger.
Go ahead, Secretary Locsin.
What I know is that not just as Secretary of Foreign Affairs, but as any air traveler, is that you cannot even get out of the plane unless you give the details that says where are you living, what is your address. I have been reprimanded in airports for failing to give the exact address of the hotel. Therefore, that slip of paper is in the custody of the Bureau of Immigration, and there is no such thing as a right to privacy. Otherwise, we are open to foreign invasion.
Mr. Chairman.
We would like to request the DOH to coordinate with the CAAP, the Bureau of Immigration, the PNP, to aid in tracing of contacts like during the nCoV incident in 2013. Pwede nyo pong pag-usapan yan sa inyong interagency task force, Secretary Duque.
Mr. Chairman, I just guess one point, Mr. Chairman, with the indulgence of our distinguished. I think it's important to find out who is in charge, Mr. Chairman, from DOH, who is in charge of this tracer contract tracing, Mr. Chair. Kasi I think lahat tayo, overwhelming yung consensus ng buong Senado na unacceptable po yung at this point in time, we are only talking about the passengers on the plane, 17%. 17%. We wanted to find out who's in charge, who's accountable. Kasi kung sasabihin natin, ready tayo, we're doing everything we can, and then we hear from the horse's mouth na hindi sila na-contact, hindi sila na-coordinate kung paano sila makakatulong. We just wanted to know, Mr. Chair. Thank you.
Mr. Chairman, this is quite operational, and I have been in touch with our Epidemiology Bureau. In fact, for the record, I would like to state his name. His name is Director Ferchito Avellino. And in all of our meetings, there has been no indication or no issues raised to me that this is a problem Because he's saying, he's telling me that he has already spoken to my undersecretary, but I'm not aware that this is this very operational as a Secretary of Health. I really don't know the steps, the specific measures of how this should be done. And I hope, Mr. Chairman, that you give me a chance to look into this and I'll have it investigated, because I can see here an issue of lack of transparency on the part of some of my people here. And I'd like to investigate this to go into, because alam niyo, nangyayari po lahat ito. Araw-araw, ni-interview kami, araw-araw, nagmi-meeting, may task force, may repatriation. Yung po mga ganitong operational details, hindi po nalalaman ng Secretary of Health yan. And I think some of the secretaries would agree with me that such operational details are already assumed as part of their job, and we presume this is part of the regularity of their work. So, mahirap naman po yung secretary na pakikilaman po lahat ng detalya, and I will lose sight of the bigger picture, the more strategic interventions.
Mr. Chairman.
But I will have this investigated, Mr. Chairman.
Go ahead, Secretary.
Mr. Chair, Mr. Sad to say, what we have here is a glaring example of a failure to communicate. The Senate committee is now asking for what should be the protocol or what should be the template for the process. You know, if the Department of Health will be the one that will follow up the airlines, and the Department of Health has no ascendancy nor power to put suspension or to force compliance, they will not follow. The protocol should be, once there is contact tracing, CAAP and CAB should take it upon themselves to commence and trigger the contact tracing, because they have the power and the ascendancy over the airlines. And hindi ho ba kung magpa-follow up tayo, ang magpa-follow up yung may poder at may authority para sumunod? Kung ang magpa-follow up ho, walang poder at walang authority, Panginoon ko, hindi ho susunod yan at magdedelay yan. So that to answer this statement of the Senate Committee, what is the protocol? The protocol, we must agree now that all contact tracing, following up the airlines, must come with the position on CAAP or CAB. Ganun ho yun. Mas magandang mag-follow up yung may hawak ng latigo. Kasi kung ang magpapalaho up ho, walang hawak ng latigo, uulitin ko, Panginoon, that will be delayed, baka hindi pa sumunod yan. Yun talaga yun. We have here a situation of a failure to coordinate. That is sad.
Chairman, very quickly, with the permission of Senator Binay. And
Go ahead, Senator.
Very quickly, Mr. President, Mr. Chairman, I beg to disagree that the Secretary of Health is pointing his finger at his underlings, when there is only 17% of those passengers have been contacted since this issue erupted. I think it's not just a failure of, failure of communication. I think it is also a failure of leadership on the part of the Health Department. I'm sorry if I have to put that on record, Mr. President.
Chair?
Go ahead,
I think tapos na ata yung 5 minutes ko. I only have one last question. Secretary Duque, I've heard you several times na medyo nagkakaproblema tayo kasi may language barrier dun sa mga PUIs. Tama po ba?
Yes, that's right, Your Honor.
Have you hired the Chinese interpreter na magpo-full-time?
It's the agreement that a interpreter should be hired for better communication.
So at the moment, wala pa rin tayong Chinese interpreter.
Requested the DFA for a dedicated group of translators. So we'll follow up on this, Your
So
Honor.
wala pa din ho? Wala pa rin tayong pool of translators. Secretary Locsin, baka pwedeng bigyan niyo sila ng pool of translators.
Ma'am,
if I may say, this has nothing to do with interpreters. Nobody can enter this country without filling out that form. That form is in the custody of the Bureau of Immigration, and it should have been accessible to you guys.
No, Secretary Locsin, because I've heard Secretary Duque say, yung first patient na coronavirus, medyo may language barrier daw when you're interviewing her because Chinese nga siya. So I think dapat may dedicated team din ngayon sa DOH na Chinese speaking para if there's more Chinese patients that will come in, hindi mo magiging problema to communicate with them. And I think siguro kailangan din may complan tayo, I don't know, parang Chinese complan. Kasi alam naman mo natin, at the moment, marami mo tayong Chinese workers, Chinese tourists, and baka hindi ho nakaka-reach sa kanila yung message on how to address this virus.
Yes, ma'am, but I won't throw blame all over the place except at CAB and the Bureau of Immigration. Aside from those two characters, let me just say that the Chinese language experts are deployed in China. Anything else, I think it behooves us to go to the Chinese schools and recruit them if they will join us. But yes, you're right. Also, for the tourists who are coming in, I think a program should be started to enroll the Chinese school teachers to join, and perhaps we can pay them. But meanwhile, these two characters here should do their jobs. As I was just telling them, when it's time to throw people under the bus, please, the bus is there.
Thank you, Mr. Chair.
Senator Bina, I was informed that the DOTR Secretary Tugade, Secretary Dominguez of Finance, and NEDA Secretary Pernia have to leave for another important meeting. The heads of the attached agencies of DOTR will remain here. Any senator would like to ask quick questions to the DOTR, DOF, and NEDA. If none, we wish to thank them for giving time and attending this hearing. Go ahead, Senator.
May we just appeal to the other CABSECs who are going to leave that can we get the problem of communication addressed so that we can at least when you leave, we are given the assurance that the matter will be addressed.
The issue was aptly and properly propounded here. The issue being, what is the protocol? Apparently, there is no established protocol, Your Honor. And what I'm saying now is, let it be that the established protocol is, when it comes to contact tracing, it should be CAAP that will get in touch with the passengers. Bakit ho CAAP? Kasi hawak nila yung latigo eh. Pag hindi sumunod yan, latiguhin mo yan. And then bigyan mo ng time frame yan. Hindi mo naman ibibigay sa kanila yung option to decide when to give the information. You say, in 24 hours, in 12 hours, submit or else.
As a retort, Mr. Chairman.
Senator Lacson.
Now, what happens to the principle of the unity of command? I thought this is a health issue, and the DOH should be the first line of defense, and should be designated as the OPR, the Office of Primary Responsibility. We shouldn't be blaming other people, because this is a health issue. And it's wrong to point to BI and CAAP. It should be the initiative of the DOH. And what we have here, as Senator Pangilinan mentioned earlier, is a failure of leadership.
If I may I just simply say that it was the instinct of the Department of Foreign Affairs when a health issue came up, we immediately surrendered authority to them. That should have been surrendered by the two characters I have mentioned.
That's exactly my point. The DOH should be in charge, on top of the situation, not the CAAP, not the BI, not the DOTR, but the DOH.
Mr. Chair.
Mr. Chairman.
Senator Bato, you may interject.
Well, I subscribe to what Secretary Tugadi said, na kailangan ng latigo. But at this point, I would like to request the chairman to please pasalitain natin ito tagapal, because without, sabi nga nila, without the latigo, pang mismo, nagsurrender kagad ng listahan ng manifest doon sa taga Bureau of Quarantine. Anong Bureau of Quarantine ito? Itong manifest na ito?
Senator Bato, we have a representative from PAL, Cesar Ordoyo. May we hear from you, Mr. Ordoyo?
Good afternoon, Mr. Chair. I'm John Ordoyo of the VP of Security for Philippine Airlines. Good morning, good afternoon, everyone. I'd just like to correct the impression of the good secretary regarding the cooperation that they're getting from the airlines. As a matter of fact, in tandem with Cebu Pacific, we already communicated to the Bureau of Epidemiology our concerns regarding the proactiveness of the contact tracing that is being done. As a matter of fact, we have given them the list as required because as per protocol, it would be the BOQ who should be following this up. But we waited until such time our President and CEO, Mr. Santa Maria, gave us the go signal to initiate, if possible, the airline could support. And we did that. We already submitted the names of the passengers as seated adjacent or in close proximity to the suspected or infected passenger. And as a matter of fact, just to alleviate the fears of this august body, as of the moment, we were able to contact a total of 74 as advised out of the 132. So meaning it's about 21 of the 31 passengers who are closely seated, the 2 passengers were already advised. And we were given the impression that they reached out already to the passengers. So they told us 2 of them contacted DOH. And this is coming from the Office of Epidemiology. So at this point, Your Honor, Mr. Chairman, I think the airline is in full support and cooperating and proactively doing this because we know the effect and of course the risk involved in here. So we are cooperating.
Go ahead, Senator Riza.
Salamat, Mr. Chair. Sa current flow ng hearing natin, may mga 5 punto na akong nakitang lumabas. Una, palakasin yung community health surveillance. Pangalawa, yung voluntary o mandatory reporting nung mga galing sa China. Pangatlo, functional na epidemiology and surveillance unit per LGU. Na yun, Mr. Chairman, ayon sa RA 1133-2 or yung Mandatory Reporting of Notifiable Disease Act. Pang-apat, with all due respect, mukhang hindi kaya ng isang task force lang pag ganitong public health emergency kasi nga may kinalaman sa leadership and governance. At meron po akong proposal tungkol dyan mamaya, Mr. Chairman. And last but not the least, sa ngayon, in the spirit of fairness, kailan ba hiningi sa mga airlines at nakapagsalita na rin yung taga-PAL, kailan ba hiningi yung passenger details ilang araw bago nagsabi sa airline when they had confirmed the cases? Pero para umabot tayo dun sa 5 puntong iyon, let me backtrack a bit, step backward a bit, Mr. Chair. Gusto kong balikan kung papaano tayo nagkaroon ng first confirmed case of nCoV in the country. So, may please confirm these details with the DOH. So una po, she is a 38-year-old Chinese woman who traveled from Wuhan to Hong Kong on January 20 and arrived in Cebu on the 21st. Is this correct, Mr. Chair?
In fact, we have a slide to show.
Thank you, Mr. Chair.
Timelines.
Yes, Mr. Chair. I'll just continue. It's all right, Secretary. Gusto ko lang pong establish yung timeline para makamove forward tayo sa ano yung kailangan natin gawin. Pangalawa, so is it also correct to say that she was asymptomatic at that time? Ibig sabihin, walang sintomas, walang ubo, walang sipon, walang lagnat.
Tama po kayo.
Thank you, Mr. Chair. is it also correct that she traveled pa from Cebu to Dumaguete on the 22nd January, Mr. Chair?
Tama po kayo.
And is it also correct that she spent 3 days in Dumaguete before flying to Manila on the 25th?
Yes, tama po kayo.
And then, January 30, 9 days after niya lumapag sa Pilipinas, she became the first confirmed case of nCoV in the Philippines. And is it also correct that she, at ito, Mr. Chair, sobra kong na-appreciate sa babaeng ito, is it also correct that she voluntarily went to the hospital to have herself checked? At yun ang dahilan kung bakit siya na-confirm. Tama po ba?
Yes, ma'am.
Alright, Mr. Chair. Ngayon, ang China-wide travel ban ay nitong linggo, February 2. Ang worry ko lang dito, Mr. Chair, ay marami-rami na ring kaso na mga kagaya ng ating first confirmed case. Possibly. Pwedeng mamasyal pa kung saan-saan, dumadami ang contact points. Mr. Chair, alam ba natin kung ilan na ang nakapasok sa bansa mula nung nag-lockdown ang Wuhan noong January 23 at bago ang ating travel ban? Nakakapag-report ba sila sa ating health authorities? Alam na natin kung ilan at sino sa kanila ay may sintomas at nasa na sila sa bansa ngayon. Namomonitor po ba natin sila, Mr. Chair?
Yes, Your Honor. Meron po ako ritong datos na pagdating dun sa hotels, resorts, hospital, public vehicle, other venues, maganda yung performance eh. For example, the number of contacts on home quarantine, 36/41. Sa hospital, 5/5. Sa public vehicle, 1/1. Sa other venues, 4/5. Ang katakataka lang po rito talaga yung sa flights. Kaya nga, I want to, in fact, let me just for the
Mr.
record...
Secretary, I'm sorry to interrupt at this point, but I think the point has been clearly and correctly made na kailangan, and DOH has all demanded, as the commander under this unity of command that Sec. Locsin said, to acquire that data in the interest of public health. But please do submit yung mga data na sinabi nyo earlier sa committee through the chair. Pero what if, Mr. Secretary, in the case na kapag yung isa sa mga traveler na ito ay magkasintomas na pero ayaw mag-report, ano po ang gagawin, paano sila i-manage?
Okay, like the one in the Iloilo event, the EB called the embassy and in coordination with the PNP.
Thank you, Mr. Chair. At least nakikita yung interagency cooperation to respond to problematic situations like that. Paano naman kung may isang Pinoy, nagkaroon ng contact, nagkaroon ng sintomas, pero dahil Pinoy tayo, di ba, takot tayo sa ospital, minsan sa gastos, kung simpleng ubo, di naman tayo automatic na nagpapacheck up. Handa po ba ang DOH sa ganitong scenario, Mr. Chair?
Handa po. At saka yung pong kanilang agam-agam na baka hindi sila makabayad, meron na po tayong ginawa sa PhilHealth nCoV package, which is 14,000 per member who is admitted for nCoV illness. So, ito nga lang po, Mr. Chairman, with your permission, I just want to put on record that itong mga ito, ako na nga po ang nagmando sa akin po mga tao na you have to give me the names of all the people that these patients had interacted with. It was me. You ask these guys. And kaya nga, I'm really worried because there's an institutional competency problem here. Because
and we will get to that, Mr. Chair.
And then you start looking into such granular, and in fact, I did it. You can ask these guys. I've been telling them, you give me the target. You have to identify, there has to be a metric. You have to show me the number of people that these patients had interacted with. There has to be some kind of a projection of numbers.
Yes, Mr. Chair. And I believe
4 by 4 by 4.
yes, Mr. Chair. I
Apat
believe
sa harap, 4 sa likod, 4 sa kaliwa, 4 sa kanan. So sabi ko, o di gawin ninyo. And ito naman, yung akin, with all due respect, sinabihan ako na baka daw naglakad naman yung pasyente throughout the fuselage of the plane. So pwedeng umubo, pwedeng may nahawakan. So go ahead, sabi ko, if that's what you think,
then go ahead. That's your job. That's your competency. You don't expect the Secretary of Health to know the operational detail of contact tracing. I
Mr.
know the
Secretary,
importance of contact tracing.
there is one thing that the Secretary, as the chair of PhilHealth, could know, so gusto ko pong i-put on record ito sa ating komite for further discussion. Nung panahon po ng outbreak ng SARS 2003, ang PhilHealth package po noon ay may halagang 50,000 pesos. Pero sabi nyo po, para sa nCoV 2019, 14,000 pesos lang. So baka that is also something for our committee to look into further. In any case po, Mr. Chair, no, nakakabahala po yung iba't ibang ganitong mga sitwasyon at scenario. I also want to put it on record that I am grateful for the hard work of our Department of Health. I'm sure hindi pa kayo nakakatulog, on-call po kayo 24/7, and the public would be grateful for a stringent community health surveillance to be put in place right now. Right now, Mr. Chair. Alamin natin kung ilan at nasaan. No excuses on the part of any of us. Ilan at nasaan na itong mga nakapasok bago pa ang lockdown at travel ban, lalo na yung mga galing sa China in the past 2 to 3 weeks. Magkaroon ng voluntary or mandatory reporting, i-monitor ang kanilang kalagayan at bigyan sila ng angkop at sapat na healthcare interventions. May mga nagsasabi na huwag mag-panic, Mr. Chair. Tama naman iyon. Pero hindi mo rin po masisisi yung ilan nating kababayan kasi hindi pa naman ka-level ng Japan ang ating healthcare system. So I really believe we really need to do all of these necessary precautions. And kaugnay nito, Mr. Chair, sa ilalim nga po niyang RA 1133-2 o Mandatory Reporting of Notifiable Disease, may dapat pong nakatalagang epidemiology and surveillance unit sa bawat LGU, sa bawat health facility, sa bawat points of entry. So, ilang ESU po ang naitayo, Secretary, simula nang maipasa yung batas? Ilan po ang target pa na maitayo? At ilan po dito ang functional?
The 17 regions have the epidemiology surveillance units, which are all functional.
Below the regions, Mr. Chair, meron din po bang LGU sa lower level, closer to the ground, closer to the people, na mga LGUs po natin?
I'm told there are about not more than 10, Your Honor.
So siguro, Mr. Chair, that's also something for us to look into, na makapacitate, masuportahan yung ating lahat ng mga LGUs, lalo na po yung mga low-income LGUs. Yung health facilities po natin, at yung points of entry po natin, meron po ba silang mga epidemiology and surveillance units?
Meron po tayong designated lang na mga epidemiology surveillance officers. It's a plantilla issue that we hope to be able to make the representation with the DBM to allow us to create additional plantilla positions.
Well, nabanggit na rin po kanina, Mr. Chair, yung possibility which I think everyone around the table ay susuporta ng supplemental budget kaugnay nitong 2019 nCoV. Pero yung RA 1133-2 ay naipasa po nung nakaraang kongreso pa. So dapat naging proactive tayo, siguruhin na lahat ng dapat tinayuan ng ESU ay naitayo na bago pa nagsimula yung ganitong public health emergency ulit. At lahat po ba, at least ng mga established ESU natin, yung sa 17 regions, yung 10 others sa lower levels, kung saan po nakadeploy yung ating mga designated officers, ESU officers, lahat po ba niyang mga ESU ay may kakayahan at handang tumugon kung sakaling magkaroon ng local outbreaks?
Our regional ESUs have the capacity because they in fact underwent massive training for 2 years in terms of leveling up their competencies, Your Honor.
And what about, Secretary, yung 10 lower-level ESUs? At yung mga ESU ba or kung saang opisina nakadeploy yung ating ESU designated officers?
Well, what they have been provided is a basic training on field epidemiology. However, these are all supervised by the regions, and the gaps are being assessed every now and then to be able to address those gaps, Your Honor.
Well, bilisan po natin, Mr. Chair. Hindi na panahon para mag-assess lang. Kailangan kayo po talaga yung front line of defense natin sa anumang public health emergency. And paalala ko lamang po na under that law, all LGUs may ESU dapat. All LGUs. Mungkahi ko po, Mr. Chair, na i-audit ang kasalukuyang bilang ng mga ESU at siguraduhing functional ang mga ito sa susunod na mga araw at linggo, lalo na sa mga lugar na pinaglalagian ng mga bisitang nanggaling at dumaan sa China, anuman ang nationality nila, at sa mga lugar na mayroon ng confirmed cases of nCoV. Kaugnay po nito, Mr. Chair, gusto kong malaman mula sa DILG kung naihanda ba nito kay Sec. Anyo, policy guidelines, programs, plans, ang ating mga LGU, yung kanilang mga responsibilidad sa ilalim nitong RA 11332. At may baseline po ba ang DILG at ang DOH kung anong capacities ang kailangan pa ng ating mga LGUs in relation sa 11332, Mr. Chair? Anyo, please.
Yes, ma'am. We will work that out with the DOH and comply with those requirements, Mr. Chair.
Ang tanong ko po, Mr. Chair, ay kung naihanda na ba yung ating mga LGUs para sa kanilang mga responsibilidad sa ilalim ng RA 11332?
Yes, Mr. Chair. We've been doing, even in our newly elected orientation, kasama po yan sa aming mga dinidiscuss with our LGUs.
Siguro po, Mr. Chair, pahingi na lang po ng in writing yung update po ng DILG for the appreciation ng komite para mas epektibo pa kaming makasuporta doon sa mga LGUs natin na in partnership sa DOH, ang frontline of defense talaga, lalo na laban sa anumang posibleng local outbreaks. At Mr. Chair, nabanggit nga po, yes, Mr. Chair.
Secretary Lorenzana wishes to be excused, but before that, moving forward, a few questions for Secretary Lorenzana, Secretary Bello, and to the DFA. What are your plans for our OFWs in the affected areas? Papauwiin ba natin sila? Pinayagan na ba sila? How about the Filipinos who are coming together with the DFA? What are the preparations in place for this? Is our quarantine facility in Fort Magsaysay ready as directed by the President to Secretary Lorenzana? Handa ba yung ating pasilidad sa Fort Magsaysay?
Mr. Chair, yes, it's always ready there. About half of that is not being used anyway, so we can make that available for the quarantine purposes of our OFWs.
Ano pong capacity nito?
The whole facility, Mr. Chair, is capable of accommodating 10,000 patients.
Okay. So, to Secretary Duque, yung RITM natin does have the capacity to handle the laboratory testing of a growing number of persons under investigation and also to manage these confirmed cases, if ever. And how long is the procedure? During the budget deliberation, we have increased the budget of RITM for 2020 to further capacitate the RITM from the proposed 118 million to we have increased it 223 million. Gaano katagal po itong testing? Makukuha ba kaagad yung resulta para magkaroon kaagad ng peace of mind ng ating mga kababayan?
Your Honor, Mr. Chairman, the RITM has just gotten the RNA primers needed to test for the novel coronavirus from Japan. And these arrived Wednesday last week, and they had to they had to run the test, they had to prime the test, and on Friday, they were able to actually do the test for the novel coronavirus. So it takes about 24 to 48 hours before the results are out. But having said that, we understand that the capacity of the RITM is down to the max. And we have, in fact, agreed yesterday that the RITM has to quickly assess the laboratory capacities of the private sector facilities, the hospitals, laboratory diagnostics, and they will be supporting them so that the private hospitals will, on their own, be able to quickly test for the novel coronavirus. So this is now in place. The WHO has already provided the primers for not just RITM but also for capacity building for the private sector hospitals. So yan po, yung isa pong primer, ito po 1,500 ang kayang gawing test. And I was told by RITM there are already 2 sets of RNA primers. So makakapaggawa na po sila ng 3,000 tests. Ang problema lang po, dahil ang test results come out from 24 to 48 hours, talagang hahaba ka po yung linya sa RITM. Kaya dapat we have to have simultaneous testing capability, and that's where the private sector has come in, Your Honor.
Secretary Lorenzana wishes to be excused if there are no questions to the DND and also to the Chief of Staff. Laging handa naman itong mga sundalo natin para tumukon kaagad sa pangangailangan ng ating mga kababayan. We thank Secretary Lorenzana and General Pilimon Santos for attending this meeting, sir.
Thank you, Mr. Chairman.
Go ahead, Senator Risa.
Thank you. Thank you, Mr. Chair.
This is your last question.
All right, Mr. Chair. My last question for my first round kasi meron pa akong ibang mga tanong. Kaugnay po nung ating mga OFs. Nung nakaraang linggo, nanawagan ako ng full assistance para sa ating mga OFWs na mga kailangan ng tulong sa kanilang repatriation kung kinakailangan. So dagdag po dun sa sinabi na ni Sec Lorenzana, maaari bang magbigay ng update ang ating DFA kung ano na ang plano at aasahan mula sa mga magbabalik bansa mula sa mga lugar na apektado ng nCoV outbreak? Ano ang ginagawang paghahanda para dito, lalo na sa kanilang reintegration sa kanilang mga pamilya at komunidad, Mr. Secretary, Mr. Chair? Secretary Locsin, update on plans at yung mga asahan ng mga maaaring ma-repatriate ng mga kababayan natin, paghahanda, and then lalo na for their reintegration to their families and communities.
I don't know about the reintegration, but I do know that we have now coming in from Hubei province. I immediately turned to the boss of this whole operation, who is now overburdened. What do we do? And they said, and he said there are protocols for that. They will be stopped at the airport. They're arriving in Clark, and then they will be taken to quarantine facilities. Now the question is, what about those? And I raised this yesterday. What about the Filipinos who came, for example, from Hong Kong, and their employers want them to go back because the domestic helpers in Hong Kong are well treated. They are not treated savagely as they are in other countries. In Hong Kong, they are cherished. And Carrie Lam, the executive of Hong Kong, has asked, please, can they come back? And the debate yesterday was this. If we send them back, then they go into harm's way. But I have an argument for that. If we send them back and something happens to them, well, the facilities of the Chinese government, I assure you, are superior to those of any other country in the world because they are tackling the disease. So I have appealed that they be allowed to go back. Now the question is, isn't it the duty on our part to protect them? This came up already in the question of our workers in Tripoli. The workers in Tripoli said, can we go home for Christmas? And some departments said, well, if they do, we will stop them from going back to their jobs in Tripoli because there is danger there. My argument was this. If we don't let them come home for Christmas, they stay in Tripoli, they will be killed in Tripoli. But if you follow me and you let them come home for Christmas and let them go back to their jobs, supposing something happens to them, well, they will die happily because they spent Christmas with their family. Now that may sound like a joke, but I don't joke with the lives and the feelings of my people abroad. It is easy to talk about my people from here, but I care for them, not just for their safety, but for their feelings. That is the policy of the Department of Foreign Affairs.
Thank you, Mr. Chair. So siguro, in my second round, kung may second round tayo ngayong hapon, pwede natin i-follow up yung other areas of reintegration at saka ito ngang issue ng security ng trabaho ng ating mga OFs. So kailangan linawin sa DOLE at POEA anong advice nila tungkol dito. Basta overall, Mr. Chair, bigyan po natin ng full assistance ang ating mga OFWs na nais maghanap buhay at kasabay siguraduhin natin yung kanilang kaligtasan at kalusugan saan man sila naroon. So that's it from my first round, Mr. Chair. Thank you, Mr. Chair.
The tourism impact was already presented earlier by the DOF. If there are no other questions for the DOT, Secretary Puyat is excused. We thank Secretary Puyat for attending this meeting. You have one question?
Or Secretary Puyat. Perhaps I can also direct this to Dr. Rahindra. You mentioned a while ago, and I've been reading the WHO reports, that coming from the WHO spokesperson himself, Dr. Christian Lendmeyer, that there is supposed to be no travel ban. Are you reiterating this? Because I've been glancing at IHR rulings that there has got to be one voice. No offense to Secretary Locsin, IHR here is not human rights, international health regulations. So, ano po, you're a foreigner, I'm a little bit confused. You are recommending a no travel ban, while some sovereign states are imposing a travel ban. So which is which? Which should supersede? Because everything emanates from your directives as the World Health Organization, and that probably would be the concern of the Secretary of Tourism. Is a travel ban needed right now, or do you leave it to the sovereign states to decide whether to impose such a ban? Doctor, a short answer.
With your respect, sir, the WHO recommendation is a global recommendation. As I mentioned earlier, it depends on the travel pattern, meaning your proximity and exchange number of people, and also your healthcare facilities. Basically, the risk you perceive that this outbreak in China poses to your country. So our recommendation, being a global recommendation, is that to minimize social and economic disruption, we do not see a point in restrictive travel bans. But this is just a recommendation. We have left it up to member states based on their assessment of the risks they face and the capacity of their health systems to make their own assessments. This is a sovereign judgment.
It's just a recommendation. And
yes.
While we are having a hearing here, we were just informed that a third victim died in Hong Kong, and a cruise ship is now being held in Yokohama, containing 3,700 tourists being quarantined right now. So, in effect, you're leaving it to the sovereign states to decide whether to impose a ban or not.
Yes.
So, Secretary Berna, I think the tourism industry is you have a friend coming from the WHO. Tourism will still flourish, not just for domestic tourists, but even for foreign travelers. Is that the impression?
So, to clarify, sir, our experience based on previous travel restrictions have shown that these are not 100% foolproof. But we also recognize that China has imposed its own travel bans, including a lockdown of Wuhan and other cities in Hubei province, and also enforced a travel ban for tour groups of Chinese citizens leaving China.
So they are also discouraging unnecessary travel of Chinese outside of China, and they are also enforcing exit screening at international airports. This is also their effort to minimize international spread.
Thank you, sir. Thank you, sir. Mr. Chairman, we can dispense with the presence of Secretary Berna.
Thank you, Secretary Berna, for attending this meeting. You are excused. Next is Senator, it's your turn.
The permission of my colleagues to continue with my questioning addressed to Secretary Duque. Secretary Duque, you're not under investigation here. I'd like to congratulate you for your initiatives. I just have some questions relative to your Resolution 01, dated 28 January 2020. This has something to do with the Interagency Task Force. Probably, just as a policy recommendation, why don't we include the Secretary of DepEd, the Secretary Briones, considering that we have 27.2 million students in public schools and private schools right now. So kailangan din po sigurong matulungan yan, Secretary Duque. And then, again, I think you are well suited for this position because as former chairman of the Civil Service Commission, we have more than 1.7 million employees. I think you can have your appropriate inputs relative to the operations of this interagency task force that was organized. But one important question before I finish this, Mr. Chair. Sabi ni Secretary Duque kanina, hindi ko nababanggitin tong Cebu Pacific Flight 5J241 Hong Kong Cebu, DG6519 Cebu Dumaguete, hindi ko na po babanggitin yon. Hindi ko kayo tatanungin doon. Sabi niyo po kanina, you received an X amount last night coming from the President himself, 2.25 billion, and I heard that the bulk of this will be used to purchase chemical suits for persons who will be the first responders or the frontliners. Tama po ba yun, Dr. Duque?
Tama po. Ang tawag po doon yung HAZMAT, the hazardous materials, which constitutes the personal protective equipment, as I have enumerated, yung goggles, yung gloves, yung N95 mask, the gowns, the aprons. So, kompleto po ito at 1,500%.
Siguro po, Secretary Duque, with that amount, and having heard your statement a while ago that you acquired from Japan 2 sets of primers. These are the testing kits. So nakakapagtaka siguro bakit 2 sets lang yung nabili. If this will be a full-blown epidemic, baka kulang po yung 2 sets. Sabi nyo, pipila, 24 hours ang resulta bago lumabas. I think 2 sets would not be enough. I think you should have sets in Mindanao, Visayas, the National Capital Region, and even Clark Air Base. So, hindi ba pwede yung dagdagan yun?
Yes, sir. Hindi po ito mga test kits. Ito po yung RNA primer.
So, what's the difference between a primer and a test kit?
Ang test kit ito yung mga rapid diagnostic test, which we still don't have, by the way,
we don't
available
have
in the
a test
market.
kit.
Wala. Itong ginagamit natin is a chemical na pinadala po sa atin, RNA primer, so that it's like a code that more or less it will guide you to identify. This is exactly the virus that's similar to the one in Wuhan.
So kaya po nagtatagal, Dr. Duque, ang RITM kasi wala tayong test kit. Am I correct?
Wala pa ho kasi. It's not available.
No. The WHO can correct me. I heard that Thailand, there was a recovery in Thailand, a 71-year-old male recovered a while ago. But going to the test kits, no, with due respect to Secretary Duque, it was just announced that Jiangsu province in China has developed a test kit for nCoV that works in under 15 minutes. And the latest report is that the detection kit can detect the virus within 8 to 15 minutes and has a high sensitivity and is easy to use and transport, and it is now being mass-produced at 4,000 kits per day. siguro we can get hold of that. We have an ambassador in China, some consul generals in several parts of China. So sila naman nag-invento nitong sakit na to. Baka makabili tayo dito sa Jiangsu province, 4,000 kids with the budget given to you by the president last night. Just a